want to take a minute afterwards or between, there is our clinic back there, Lake Rock Creek Animal Hospital, and then we have Adventure Canine Academy. They're into behavior and training, and right now offering adventure day camps. And then Angela with Big White Dog Photography, she's doing a fun event this summer called Adventure with My Co-Pilot. And maybe at the end, Andrew, you can talk a little bit about that. Okay. And so we're gonna get Dr. Marty Becker on the screen. He is the founder of Fear Free. And our goal in doing this is the term fear free basically means we want to look out for the mental well-being of your pet, our patients, when they become our patients, that is our focus. Fear Free as a company has done a very good job getting Fear Free well known within the veterinary industry, but not out to the public, which is what we has become part of our vision. Dr. Megan and I, Dr. Megan on the end there. Hi, Dr. Megan.
Hello. I'm socializing. I'm Dr. Megan.
She's a forever talker. She likes to talk to everybody. Dr. Megan and I co-own Lake Rock Creek Animal Hospital. It is our mission to be the best fear-free hospital we can be, and that means getting out to the community. Of course, we cannot be the vet clinic for everybody in Spokane. There are a couple other fear-free certified practices in the area. The cards in front of you, that QR code will take you to a web page that has a fear-free directory if you want to look up fear-free professionals or vet clinics. It also has contact information for our clinic and for Adventure Canine Academy, and then I'll put Adventures with My Co-Pilot on there as well as handouts. We didn't print any handouts, but when you hear us talking about fear, anxiety, and stress scores and body language, those handouts are on that website for you guys to refer to now or at a later time. Yes?
When you say hospital, do you do work on emergencies also, or?
In the veterinary field, it can be a little bit deceiving. In the veterinary field, whether it's called medical center, clinic, hospital, most are just general practice veterinary clinics. You know, we'll take emergencies if they come in during our regular business hours. So it can be a little bit deceiving because I know in human it's a little bit more specific, not so much in the veterinary field. So I'm gonna get Dr. Becker on here so he doesn't think we forgot about him.
The microphone's off.
Okay, so once he gets on, he'll introduce himself and kind of talk a little bit more about Fear Free.
Hey, it's Marty.
Hello?
Marty, how you doing?
Hi, is your camera on?
I can't, I'm gonna try it working again. I'm just calling in on the number. I figured if I couldn't get on.
Do you want to try the camera?
Yeah, I'm talking on my phone. Let me get it to work again.
Okay.
Do you have your granddaughter or someone young there who could help you?
Granddaughter left town.
Oh, no, just on your own. All right, while we're waiting, do you want to talk about what you do at OSU?
Yes.
This is Dr. Fanucci. She's a behaviorist and clinical professor at Oklahoma State University, and she can entertain you while we figure this out.
Yeah, so we're gonna have an opportunity to have a great discussion today about all the things that we do with Fear Free. I see behavior patients, that's my specialty, that's what I do every day. So of course, I see a lot more behavior cases because that's what I focus on. But a lot of my patients have, a combination of medical disorders, behavior disorders, and we use Fear Free approach to treat the whole patient. So today you're gonna have an opportunity to ask us all the questions, no limits, right? All questions are on the table. And we can discuss the pros and cons, the difficulties, everything that we can do to mitigate fear and stress during the exam, during the vaccine appointment, or for procedures, everything that we can do to facilitate things for our pets when we have to take them either for a vaccine appointment or, to see a cardiologist or emergency and everything, okay? So there he is.
See?
We'll continue later.
She gave him a good intro.
Can you hear us, Dr. Becker?
I can. Hi, Letticia.
Hi, how are you?
Good.
You're larger than life, Dr. Becker. Oh, there we go. Look at that.
For those of you out there, I look like a human Shar-Pei. Look at my neck.
Well, who doesn't love a Shar-Pei, Dr. Becker?
I'm gonna get a gigantic alligator clip and just put it back there.
Or just like an Elizabethan ruff, like they were in the old days. That'd be pretty slick, I
There you
think.
go. There you go.
Okay, Dr. Becker, would you like to introduce yourself and do an introduction about Fear Free?
Yes. Well, hi everybody. I got a dear family friend that's having her 80th birthday. So we're over here south of Moses Lake. I didn't think anything could get uglier than Moses Lake, but it is actually uglier than Moses Lake where I'm at out here between here and Tri-Cities. So, and let's just say it's not exactly the Cherry Blossom Festival with all the feedlots around here. So we stopped here and I'm Dr. Marty Becker, born and raised in southern Idaho down in potato country, then met my wife of, look at her over here, hiding over here in the
Hi,
corner.
Teresa.
Met her 47 years ago, and we live in Bonners Ferry, Idaho, at the other end of the state. Live on a horse ranch up there, and still practice from time to time after all these years, 45 years of practice, and was the founder of Fear Free, and just really feel blessed to be able to have a few words with you guys today. And hopefully, I don't know if you guys have told them, my friend Temple Grandin might be calling in, so that'll be a nice surprise. She does.
We did not give that secret away.
Yep, you had to come here to get to know that Temple was going to be here.
We let you say that. So do you want to give a little introduction to Fear Free?
Yeah. So if I could go back to veterinary school, I don't know if any of you are veterinarians or involved with the veterinary community, but like many people, I wanted to be involved with animals from the time I was about 6 years old, but wanted to be a dairy practitioner. And so that got me from age 6 to 20, and I was in veterinary school and listening to Dean Leo Bustad, who was my dean, the guy that coined the term the human-animal bond, and he gave a talk introducing us to our first day of school, and within a half hour I decided, oh hell, I'm going companion animal, man, talking about the human-animal bond, that affection connection. So my dairy career lasted 30 minutes and became a companion animal practitioner. This is the 70s. I mean, I smoked more pot than Cheech and Chong back then. Drink beer, skip class. I have zero idea what Leo Bustad saw in me, but somehow he thought I would be a good person to help popularize the human-animal bond. So he kind of took me under his wing, and that led to Chicken Soup for the Soul books, and that led to getting on Good Morning America. That lasted almost 20 years, a syndicated column and a bunch of other books along the way. And then it was in 2010, I was at a veterinary conference on Vancouver Island in Victoria. And a board of veterinary behaviorists named Karen Overall gave this talk about fear. And first line is fear is the worst thing a social species can experience, and it causes permanent damage to the brain that those of us in veterinary medicine and things working with animals, i.e. groomers, trainers, pet sitters, boarding and daycare, but specifically veterinarians were causing repeat severe psychological damage to pets by what we were doing or not doing. Behavior produces a physiologic response, so behavior is medicine. Fear is caused by something painful or something disturbing, and she gave an example of trimming nails too short. That's painful. Now when the pet sees the nail trimmers or follows the well-worn path in the vet clinic back to where their nails are trimmed, that's disturbing. A syringe, injection of Serenia, long-acting antibiotic, blood draw, vaccination, all painful. Now the pet sees a syringe, that's disturbing. Temple loves it when I call syringes the weapons of mass destruction in a veterinary practice, but there's no benefit from a pet seeing the syringe. And then what really got me, she said, all animals are the equivalent of a 1-year-old child. They are taken against their will for care, her words. Number two, they have zero idea why any procedure benefits them. How would they know looking in an ear that looks like a fire pit benefit them, or looking at teeth that look like a flamethrower went across it, or examining a wound, or a painful abdomen, or a arthritic joint, or giving them an injection, stuffing a pill down the throat, or laying them out on their back and stretching them out into 2 zip codes to take a radiograph. How would they know that benefits them? And finally, and maybe most importantly, they can't flee the threat. Even if they think they're going to be harmed or killed, they can't flee the threat. So they're kept in a place, and basically it's PTSD. It's severe psychological damage to these pets. And listen, when Temple Granite gets on here, Temple Granite is gifted. Marty Becker was not gifted. I was stretching cats out into 2 zip codes before Fear Free, and I've had multiple dogs poop in my pocket over the years during some various struggles in different locations. But I was smart enough to realize, okay, let's go back to boarded behaviorists. Let's figure this out. And of the 100 boarded behaviorists in the United States, approximately 160 are on the Fear Free Advisory Group. There's 20 boarded anesthesiologists and pain experts, animal handling experts, subject matter experts. So I think there's 256 people that form the Fear Free Advisory Group. So we spent 5 years in proof of concept. We launched it on an online education company in 2016, and April 1st, hoped for 1,000 people by the end of the year. We had 10,000. And now we have 400,000 people certified, which just seems crazy. Soon to be about 700 Fear-Free certified practices. About another 160,000 people at the shelter will have completed a 5-hour online course. If you know anybody that's in shelters or rescue, it's fearfreeshelters.com. It's complimentary. All 207 AVMA accredited veterinary technician schools now require Fear-Free certification of all students before graduation, as do 4/5 of the 43 veterinary schools. So I was just seeing in Oregon, and went in to buy some antibiotics for a friend of a friend there to get him some Clavomox. And the veterinarian people there are certified, but she wasn't Fear-Free certified practice. And she said, I can't find a veterinarian. We can't find a veterinarian. Well, hello, they're getting 12 to 14 job offers. And now, increasingly, because they learn animal handling their first week of school, either as a tech or a vet, they're seeing it in the teaching, so they're learning it in animal handling, they're seeing the teaching hospital, they're doing it in community practice, and when they come out, they don't want to go rodeo, judo throw, rugby scrum of my days, where we just take everything in the back and pile enough people on them to get a procedure done. So it's what would I say? It's when people ask me to describe Fear-Free, it's just looking at the physical and emotional well-being of animals. We do both, high tech, high touch, state of the art, state of the heart. And I don't know if any of you know the new little baby elephant at the Oregon Zoo, Tula 2. it was my 35th birthday, but I really did go to Portland to see our son. We wanted to see that dang baby elephant at the zoo. It's a little premature Asian elephant. And there's more enrichment activities in that zoo than in people's homes. And that's another piece. It's not just enough to reduce fear, anxiety, and stress. It's not enough to mitigate pain. We have to start letting animals have enriched lives. And Jessica and Dr. Megan, if you'll let me kind of wrap this up here. When Fear Free started, I don't know how many of you are in the veterinary profession, but we take an oath to prevent or relieve animal pain and suffering. Oath is a sacred promise. And so we have an obligation and opportunity to look at both physical and emotional well-being. There's a study coming out, it's about a month embargo, but it's a month from 3 veterinary schools showing the dramatic decrease in injury, about a 70% decrease in injury in fear-free certified practices. We're the only profession I know of that has a 100% injury rate every year. You know, we have family members that are in hard rock mining, roofers, loggers. Nobody has the injury rate that veterinary medicine has. It's better medicine. Steve Ettinger, a name that some of you might know, but the younger generation has no idea of veterinarians who Steve Ettinger is because they don't buy the textbook of veterinary internal medicine anymore. He served as our chief medical officer for about 5 years. The medicine is better. The vital signs are more normal. The physical exam is more normal without heightened pain and sensitivity. You don't get immunosuppression, which delays healing and recovery. The blood work, you don't get the leukocyte shifts, so the diagnostic tests are much more normal. It's easier to track, develop, and retain people. There's a new white paper coming out in about 4 months. It shows, again, the increase in practice KPIs and net income. And finally, I think for me, when I still practice, it makes practice fun again. You know, when we love animals and one of them loves back. And when they actually are neutral to either dragging their mom or dad in to come into the veterinary practice because we put the treat into treatment, that's a pretty good feeling versus us having to try to, drag them into seeing the pet parent try to drag them in the hospital and then the dog taking them out at supersonic speed. So I'm proud of Spokane because there's 5 fear-free certified practices. And then in San Point, Idaho, that's where Fear-Free started at DCA North Idaho Animal Hospital. So I really appreciate you guys all coming out. I'll make sure Dr. Megan and Jessica give you my full contact information if you ever want to come up and say hi or want me to swing in and see where you work or something like that. My crew lives on the South Hill in Spokane, so we're there very frequently.
Thank you.
Thank you.
Thank you.
So, when he's describing how we still do, some do, we don't, but used to do in the veterinary field to get the dog vaccines, to get the dog the nail trims, to get really anything done, we're having to hold down, we're having to scruff, we're having to stretch, we're having to do all of these things that maybe you see, but really you probably don't because your pet's probably been taken away from you and to the back, and that is not, we're not here to talk poorly about it, it's just now there is a better way. And now you shouldn't have to be your pet taken away from you. They shouldn't have to be scruffed. They shouldn't have to be held down. We have pharmaceuticals that can help with that and low stress handling techniques. So one of our goals that I mentioned a little bit earlier is that we want to get this and the name Fear Free out into the community so that the community can go to, we'll teach you, we'll give you ideas on how to advocate for your pet at your clinic if they're not Fear Free certified, because we understand, if you have a vet, you love your vet, you want a relationship with your vet, you're loyal to them, but maybe they could do some of these things, or here's things you can do to go to your vet that will help, and they don't have to change anything that they're doing.
And those of you who are our clients, you may have to go to the ER or a specialist, or you're traveling. So even if you do go to a Fear-Free certified practice, you're gonna find yourself in that situation sometimes. So that's tips you can take away no matter what.
So we'll go through, we have the bullet points that we had listed out in the registration page, so we'll go through those. We also did get a little bit of feedback for those who registered online, and so as we go through, if you have questions, let us know, but we'll try to touch on the ones that we got in online. Okay, you wanna start?
Sure.
Okay.
Well, first I'd like to ask, I know the answer for some of you, but still, who has dogs? I figured. Right. Who has cats? Okay, some cat lovers here. Any exotic pets, rabbits, bearded dragons? Yeah, I know that's right. I can't wait to see your exotics. But, okay, so obviously we all have some pets. We're gonna get more pets. First thing we wanted to talk about was just bringing a new pet home. I mean, that's really step one, is you bring a new pet home. Now what? There's always that time when you think, oh my God, I shouldn't have done this. We all do that. Every single pet I've ever gotten, personally, I've been like, oh my God, why? And then it's okay.
I'm doing that right now.
Yeah,
I'm
right.
currently doing that.
But especially for older pets, a little bit less so for puppies because they have different developmental periods, but definitely for any adolescent, adult, we call it, some of you have probably heard this, the 3 days, 3 weeks, 3 months rule. That's how long it takes just to even have any idea who this individual is. 3 days, they may just be completely shut down. After 3 days, they start to get their personality, they start to adapt to routines at about 3 weeks, and by about 3 months, they're fully settled in and showing their real personality. Then, of course, there's your pets that you already have. It can, especially cats. I mean, it can be hard for dogs. It can be hard for rabbits. It can be hard for anybody. But cats, as those of us who have cats know, are especially territorial, and they form very tight, very specific social groups. They do not like their groups disturbed or changed at all. They do not like changes to their territory at all. So there is some extra steps you will need to take when it's a cat.
So what would the difference be with I have this adult dog that maybe came from a family that we know, or one got from the rescue?
If you know the dog, then they will still need to adjust, but you will probably at least have some idea what that final personality is going to be like. From the rescue, it's a complete blank slate. They may be shut down for even longer than 3 days, honestly, at the beginning, depending on what their trauma was. They might have separation anxiety. You don't really know how they do with other dogs because they may not ever show their full personality at the shelter. They never really adapt to that. They do their best, they try, just the nature of that environment is you're just not going to see what they're like. So being A, giving them extra time, and B, being extra careful, and whether it's a cat or a dog, any animal, giving them a safe space that is just for them. For a dog, that can just be as simple as a crate where they can just go and decompress and they know I can go in here and I'm safe. For a cat, probably a whole room with litter and a cat tree and a nice soft bed, and so that they can have that space to decompress. It really, really helps that decompression go much better. And introducing your dogs in neutral territory. Don't introduce them at home. Even if they're friends and they knew each other before, because they also know, they can sense about 3 days, it's different for different dogs, but after about 3 days, they're like, is he gonna stay? And that's when you usually see conflict. You're like, oh my God, this is great. I took him on a walk, I introduced him just like I'm supposed to. They're best friends, I went through this myself, I ran out of diamonds in the rough, I introduced him, I was puffed up, congratulating myself. 3 days later, my dog was like, okay, is he gonna go home? Where's his mom? So they do that.
Yeah, that acclimation period is much longer than people think, and I think one of the things that, just linking to the socialization idea, what most people think socialization is what we see as traumatization, because that's what we do with them. So getting that puppy, it's been 3 days, everything is going well, let's go to the dog park, or let's go to PetSmart for, shopping for things, or let's go to Home Depot. And so that overexposure of things, lights, stimuli, like people, other pets that are there, that's when things can go really bad, really fast if that pet is not ready for that. So socialization is actually gradual presentation of stimuli in general, but in slow little pieces where we can do it safely and observe how that pet is reacting in that situation, right? So we're not gonna go for that 5K run with 50 people enrolled, you know, after a week that we just got this dog from the shelter or from wherever, where you have not bonded yet, you have not got to know that animal's personality, temperament, the traits, the things that it's reactive to, the noises that it doesn't like, the lights, you know, people that it's not familiar with. So it's a much more gradual process than what people think socialization is. So that's another thing, like, you know, just got the pet, now let's socialize it. But what is socialization, right? And the definition of the word, not just what we see a lot of people doing. And then something goes bad, they either get growled at or attacked by another dog, or they don't like specific, like a lot of animals don't like men. There is such thing. There's a lot of dogs that are afraid of men, not because they hate men as a gender. The problem is that tone of voice and also the scents, the smells, the hormones are things that actually can alter their behavior, and they can react to that. So we actually have evidence on that. We have studies that look at tone of voice. Men have a more like a lower tone of voice, and that can be scary to some dogs. So we're not gonna go, you know, man with hats, man with, you know, it's not only men, sunglasses, hats, canes, wheelchairs, things that they're not used to seeing, and now there's suddenly a human that I'm not familiar with, children, yes, that now is like on top of something that rolls and spins and, you know, there's wheels in it. So all the things that we take for granted, we don't care about at all, are the things that may traumatize the animal and make a huge, then they growl or lunge at someone and you're like, oh my God, where's that coming from, right? I've never seen that before. Why is it growling and lunging at people? So we have to deal with the fear factor all the time. And fear is not something conscious, it's not something that we can regulate very easily, right? Once you're in fear mode, you're in survival mode. And now surviving is your priority. Fear takes over, overrides the brain very easily and very fast. So once they're convinced that that stimulus, you know, that thing is going to kill them or a person, once fear kicks in, that now it's much harder for us to counter that. So what's easier? To just not expose them or put them in situations where they can make bad decisions. And then here we are. Now we have to deal with this one new component that we were not expecting or counting on.
And to just piggyback off something she said, when they growl or lunge, probably everyone in this room has a basic knowledge of dog body language. At least your own dogs. People out in the community do not. So it is very likely that your dog did ask or whisper that they were uncomfortable and felt ignored, and now they have to shout.
Yeah.
Because they paused, they stiffened, they gave a side eye, they leaned away, the person still came, they're like, okay, I guess I have to lunge at you now because I'm trying to ask you to stop and you won't.
Or the way as kids we were taught to approach dogs, right? Walk up to them and
Yeah.
give them your hand. This is the way I was taught to approach dogs.
Yeah, me too.
Yeah,
Me too.
exactly.
So then what is gonna be the proper way to socialize our new pet or our new puppy? Should we separate them and do puppy first?
Yeah, let's do
Okay.
puppy first.
Okay.
Go.
Okay.
Go. You got this.
Okay, so if we're gonna take, you know, brand new puppy, there's another thing that we need to remember, ages matter, right? The younger the puppy, the less neophobic they're going to be. So the more open to new experiences they are. They don't fear a whole lot of things yet, right? So that's a very, very critical phase of their development. So the first 8 to 12 weeks, that's the critical part of their socialization. That's when we need to make sure we're setting them up to succeed. So not overexposing, gradual exposure of stimuli in general, so all the sounds out there, you know, horns, trucks, lawnmowers, all the things that make loud noises, we want those things to be good experiences.
The vet.
So, the vet, yes. Other dogs and the neighbors, so we're not gonna take that tiny young puppy to go play with the 8-month-old puppy that now weighs 40 pounds, right? So we have to think about sizes too. They can easily get stepped on, get hurt, and now I hate all dogs out there. Because when I play with dogs that I don't know, that's what happens. So what are we trying to teach them? And then how old are they? Are they ready for that exposure? So age is very important, right? Vaccine, of course, you have to be vaccinated and all that before we go out in public. But think about what you would expose a 2-3 months old baby versus a 1.5 year baby. They're different, right? Things that they can understand, comprehend, and who they can interact with. So socialize young puppies with other young puppies that are naive and inexperienced, not with bigger dogs. The first 4 months, that's when that socialization bracket starts closing, right? So that's the critical period that we call. That's when we need to set them up to succeed. After that, of course, then they're gonna start showing traits. That's when they're gonna start doing things that is just their personality traits. So then we have to work around that. What a lot of us tend to do is punish those things, punish those behaviors without understanding where they're coming from. So now they start, sometimes they start humping, or they start chewing on things, or they start guarding food. They have resource guarding, which by the way is normal in dogs. Some dogs guard stuff and some dogs don't care about guarding anything. That's a personality trait. But we see that as a behavioral problem because we want all dogs to share everything. Do we share everything?
I don't. I'm an only child.
Yeah, you may share that chocolate that you don't care about, but your Godiva truffles, you're gonna probably hide and eat alone when nobody knows it's there, right? And if someone steals it from you, you're gonna get very aggravated, which means you have resource guarding issues. Not really, right? So we guard our things. There are things that we value more. We're going to protect those things. Now, some dogs just share everything. They don't care about toys, food. There's no value for them, right? So we have to remember what's normal for dogs to do versus like what's realistic and what's an unrealistic expectation from us, and then try to call that a behavioral problem and punish that behavior. So traits will show at around 4 to 8 months of age. That's when they're showing all those things. And by a year, now you have an adolescent, you have a teenager, that's when you're gonna start having problems. They show very, very early the tendencies that they're going to have. But a lot of these things are not problems. Like territorial aggression, for example. It's another one that we get a complaint about all the time. Oh, my dog is territorial, barks at the neighbor's dogs. Well, of course it's gonna bark. Dogs are bred to be territorial. They are going to defend their area, and there's a fence there. The fence is the biggest component. If there's no fence, there's nothing to bark at, but there's a fence there. Now there's a line, I need to protect this side, and you own that side. And that fence fighting that they do is very ritualistic, by the way. It's very enriching for them.
You can see videos of a little piece of a fence with a wide open. They could easily go around. They're standing at the little piece of fence fighting.
Yes, exactly. That's a ritualistic behavior. So territorial aggression, fear aggression, maternal aggression, protective aggression, resource guarding. All of those things we call behavioral problems are actually normal. That's just nature, and we cannot fix nature because it's not broken. But we have to work with it because we have animals today living inside our homes. They're living human lives, not animal lives. They're not back in the backyard like back in the day, chasing squirrels, digging holes, climbing trees, chewing on everything. They're not living dog lives. Now they're living urban human lives, and they're supposed to behave like people. But we forgot to tell them that, you should be people now. You should be human now. And humans don't chew on wires, on shoes. They don't dig holes. They don't hide stuff in the couch. They don't bark at the people outside, the passerby. So all of those things that they do that we don't like, they're natural behaviors. Now, are we giving them an outlet to be dogs, to behave like dogs? Are we taking them on daily walks? Are they exercising enough? Do they have mental stimulation? Do they have opportunities to be dogs and not just watch TV 8 hours a day because we're gone and busy? And when we come home at the end of the day, we're tired because we worked all day, and now we don't have an hour to take them on a walk. Then what? And we come home, take them for a 20-minute potty walk, come back and like, okay, now go to sleep because I'm tired. We're going to bed, and that's the life of a modern dog these days. So if you think from a dog's perspective, modern dog life is very challenging for them because they're still dogs. They have not learned yet how to be people.
And socialization too, all these things that they have to see that they didn't have to see before. Trucks, bunches of school kids, at school, and even the things that they're supposed to chase, like squirrels, to steal a phrase that I hear Kaylee use all the time, just take them places and let them watch. They don't have to interact, especially when they're in that 8 to 16 week window. I mean, for one thing, they're probably fully vaccinated, but besides the point of that is you don't want them to have a bad experience. So just let them watch. You don't all necessarily really even want a dog that wants to interact with everything. I've had those, it's not that fun. What you want is a dog that's like, oh, okay, there's kids over there, whatever.
Not scared of everything.
Yeah, oh, there's dogs over there, that's fine. If they come over, great. If not, whatever. Just kind of blasé about things. And they can get a lot of that through just watching, which is also very easy. Just park the car when the kids are getting out from school, you know, as far away as we are from the across the street over there, and just let them see, and they'll learn to just ignore it.
Exactly.
They don't have to interact with everything.
Now, putting them in that situation, like we see a lot of times, right? No, let's socialize. No, yes, you can pet my dog. Dog is doing this. Like, oh my God, no.
It's here,
Get
kids.
out
You
of
can all
here.
pass them around.
No, let's pet the dog, and then, you know, then the hand comes, and then there's a growl, sometimes there's a bite. So when you're holding your dog, that's the worst moment someone's gonna pet, right? The worst opportunity for petting and social interaction for your dog. Because they have no way to escape. They don't know that person. They clearly don't want that interaction, but their hand keeps coming. And then when there's a growl and a bite, what happens to the hand? It goes away. And that reinforces biting. Now I learned that when I give all these signals, you ignore, you don't understand that. But when the bite happens, hands magically disappear. So next time, I'm not gonna waste my energy giving signals that you don't understand. I'm gonna resort to biting because it always works. Everything changes when there's a bite or there's an aggressive interaction like that, right? The whole dynamic of that situation changes to a new one, and the pet got rid of that interaction. So a lot of these bites that happen, the great majority are out of fear. Fear biters are the dogs that I deal with in my practice, and at least 80% of those bites could have been avoided if there was an adult behind that interaction paying attention to what's going on with that dog and not putting that dog in that situation, especially with children and toddlers, right? So now we let the child and the dog interact, and we let the decision-making process to them. They're supposed to make a good decision, and we're just there watching, when it should be the other way around, right? What's the likelihood that the child or the dog is gonna make a bad decision?
And that's what
Really
and that's what, when Dr. Becker says that in the veterinary field, we have a very high likelihood of safety issues, because we do that. We push them, we're holding them, we're scruffing them, they're trying to bite us because we're trying to continue to bother them or hold them or do something that they don't want and they can't get away, so they're trying to bite us. So when he says that a fear-free certified practice has lower incidence, that's what he's talking about.
Yes.
We've had some warnings.
Because
at our
also,
clinic.
that's another good thing, is traditionally, right, you hear this all the time from everywhere, is that when they growl, what do we say? Don't stop it. If we reinforce the growl by backing up, they're not going to bite you. Most of the time, unless they have other issues, they've been punished in the past, but left to a natural state, a dog that growls at you is trying not to bite you. A dog that snaps at the air is still trying not to bite you. A dog that muzzle punches you is trying not to bite you. They're escalating through their signals louder and louder and louder because they are trying to get the pressure off of them without hurting you.
And Fear Free has taught us, and you know, our behaviorists and stuff have taught us how to read this body language, so that at some of these clinics, we're able to read that and understand that and give some pharmaceutical intervention to help be able to give the care. You know, we have a lot of these high stress dogs that just aren't getting the care that they deserve or desperately need because, you know, owners are scared to take them to the vet because it's so high stressed. Owners don't know what to do. Some vet clinics don't really know how to handle them, and we're getting bit, and so they just decide we're just going to keep the dog home. He's not going to get the care that he needs.
Yeah, so we're really trying to change the culture, and that's the hardest thing to do anywhere in any situation. Culture is why we do things the way we do. It's been this culture for the longest time now. It is changing, but I've been in this field for 20 years now. It's gonna be 20 years this year. I can tell it's much better today than 20 years ago, but we're far from where we need to be at one day. Way far, we're way behind. We still have a long road ahead of us. And that's because of culture. Culture eats strategy for breakfast. It's the most powerful influence in our lives. The way we were raised, the way we were taught, the way we were taught to think and not question, not think outside the box and not question things, that's what drives our behavior, even when we don't feel good about it. So thinking outside the box and questioning the status quo is what we're trying to do. So it's been this way doesn't mean it's right. We care enough about our animals, you as pet owners, us as veterinarians, that we want them to have a good experience at the vet. And there are things that we can do to facilitate that. There's a lot of things, actually, multiple things that we do to mitigate that. We want their mental well-being to be as valuable as their physical well-being. And that's what we're trying to change with Fear Free. That's the mentality. So you are the best advocate for your pet. You're the only one who can actually really enforce that. So if you know what to watch for and what your pet needs, you can ask for that. And when it comes from you, it has a much greater power, I think. The change happens faster when it comes from the pet owner because you're the one who has that bond with that pet, right? You love your pet more than anyone. You know what's best for your pet better than I do. So if it comes from you, if you tell me, my pet doesn't like this kind of interaction, my pet does not handle the situation well, now it's my job to do something about it, to mitigate that and to facilitate that treatment protocol, whatever it is. It's an x-ray that your pet needs. It's a vaccine, or we're prepping for surgery, or it's a nail trim. It doesn't matter what it is. Fear Free should be in every single scenario in vet med and outside of the clinic as well. It starts at home, right, with the way we handle them, we care for them, and then the trip to the vet, what we're doing, and then after they go home too. So
And daily life.
everywhere.
Daily life. Can I pet your dog? No, he doesn't like that.
Let's go to stress in the home, dog parks, pet stores, multiple outings, grooming.
Hey,
It's a nice segue.
Hey, we'll just segue right into that. But yeah, don't be afraid to, he doesn't, I'm sorry, he doesn't like kids under 6. Or no is a complete sentence, but I don't do that very well. When in doubt, just lie. Just lie. It doesn't matter. Nobody knows. Oh, I just adopted him. I don't know yet. Whatever. I've had my dog 10 years. This stranger on the street doesn't know that. He's got kennel cough. Sorry, he can't interact with your dog. It doesn't matter. It doesn't matter. You don't have to tell them. You don't have to. I mean, it would be awesome if we made a little community of people who would go out and educate about Fear Free, but sometimes you just want to take a walk. Sometimes just no, I don't want to educate. I just want you to take your dog away. And really be vocal, but advocating for them, everywhere. That's at the groomer too. We have some information about Spokane's first Fear Free certified groomer that we can give you if anybody's interested.
Her cards are back there.
If anybody needs a good groomer, she's the only one in Spokane that's Fear Free certified. That's not to say that others aren't doing those techniques, but there's just no way to know that.
Anywhere in Coeur d'Alene, because that's where I am. Coeur d'Alene.
No one that I know of.
I know.
They're culturally, it's a tough area.
From what I know about Idaho, it is more
Yeah.
difficult than here
Yeah.
with the Fear Free journey.
Come talk to me after. I can give you a name of a
Okay.
vet that I know in Coeur d'Alene that can help you find the right groomer. Yes,
Okay.
just come chat with me later. Yeah.
Thank you.
And something that we hear a lot, which you would think, right, because this is our human culture. Okay, today's my day. I'm gonna go get my nails done, I'm gonna get my hair done, and then my doctor's appointment, and then I'm gonna go out to dinner with my friend. That is not so great for dogs. We don't want to go to the groomer, and then he's nice and clean. Okay, great, now we're gonna take you to the vet and get a shot, and then we're gonna go PetSmart and pick out a treat after. Actually, for most dogs, that's too much, and by the second or the third visit, they're gonna be completely done. And then you're going to think to yourself, why was he so stressed at the vet? Last time he loved it. And this time he just stood in the corner and panted and didn't want to talk to anybody. Even if the groomers were free and the vets were free and the pet stores were free, that still might be too much. It's not even necessarily about, oh my gosh, they must have done something. It's just too much in one day. That stress hormone goes up and up and up and up, even if it's good stress with each interaction. And then you get what's called trigger stacking, where it's just one thing after another, and then it's too much. It takes them about 3 days for the stress hormone to get out of their system after. I bet research we're going to find out it's longer, but right now we know it's at least 3 days after a stressful event for that to get out of their system. So that is another thing. I know no one in this room thinks like this because you're here, but that's another thing that we hear a lot. Well, it'll just take a second to trim his nails. It takes 5 minutes, let's just do it. You're right, it does take just 5 minutes. And then 3 days for that stress to leave the body.
And just like the veterinary field is adapting to Fear Free, not quite as fast as we would hope, but we'll get there. So are the clients, right? Clients who have pets for a long time, but you used to do this and now you can't. You used to do this, you used to do my nail trim and now you won't. And it is hard, it is a change of mindset, a change of paradigm to accept fear-free, both in clinic and as a pet owner, that we find with our own clients, it's hard, and it's hard to understand, well, why can't you just get it done? Those are words that we don't use in our clinic. We don't just get things done, because it is so stressful.
And to think about, and this could be a whole 3-hour talk all by itself. Okay, stress is in the body for 3 days. What does that mean? All of the physiologic effects that has on your system, we could give a whole speech about that. Immune system, wound healing, PTSD, metabolic functions, pain. I mean, just it's far reaching, and it is I feel like every day we
Hey, hi
learn.
Marty, this is Temple.
Oh, surprise! Hi, Temple.
Hi, Temple.
Hi, how are you doing?
Good, how are you?
I'm doing just fine. I'm at an autism conference outside of Chicago right now.
Hey, Temple, nobody was excited that I joined. And then you
Yes, we had guests in the audience when you
Well, it's
joined.
good to be here, at least by phone.
Well, thank you so much.
Does anybody have any questions for Temple? Temple, by the way, I didn't mention this. Temple and I, before we run out of gas, we want to bring fear-free to animals used for food and fiber. So y'all know the work Temple has done to change to give animals a good death. And by the way, Temple oversees the poultry part at Costco. If you love the way the poultry part works at Costco, that's because of Temple. But Temple sees the thing, what's called a life worth living, where animals get to experience behavior positive for the species. So I'm going to make a prediction with Temple's leadership. In a few years, you will see a new food category, the first new food category since organic in 1973. So with Temple's leadership, we can do it.
Well, I have a question for Temple. We were just about to start talking about stress at the vet. What do you think is the most stressful thing for pets at the vet?
Well, I think one of the problems, we got a lot of dogs today that are leading a more and more sheltered life. And so anything that's new, I think, is more stressful. They just don't get out and see enough stuff. You know, there's a reason why the service dog puppies are taken everywhere, because you don't want them to be scared. It's super important to make that first visit to the vet really good. One simple thing to do is let's put a non-slip mat on the table so the pet has a non-slip floor, because all animals panic when they start to slip. And things like just slipping around on the table could be the bigger stress than getting a vaccine.
You know, one of the things Temple did when Temple and I spent in 2020 during COVID, we spent some time in a companion animal practice, and animals' number one fear from the time of birth is the fear of falling. And just think of how many animals we've lifted off their feet and put them up on an elevated, slippery table. So a couple other things, Temple, if you don't mind me saying some stuff that Temple saw. We were in a typical treatment area where you have, you know, 2 treatment tub areas there for procedures and a big bank of cages behind us. And so there's somebody doing something you've seen a million times. You know, they're trying to induce the dog. It's a struggle. The dog's struggling, quite a bit of sound, and then finally the dog drops down. And then the clippers come, and then the vacuum comes, and Temple turned around, and all these dogs and cats behind us in the treatment area were all in defensive positions. They all had their limbs pulled in, their tail tucked in, and it was like watching a gladiator at the Coliseum. And Temple made the suggestion just to take a hospital ER kind of curtain to start blocking visual line of sight. So not just around the tubs, but the cages.
So all the cats and dogs in the cages don't see a big dog being forced. It's also something I want the pets watching. I don't think they understand what a dog under anesthesia is, but seeing a large dog forced down by several people, they know what that is. They shouldn't be watching. The other thing I want to avoid is a lot of people think it's really cute to have giant posters of staring cat and dog eyes. That's a threat. Yeah, you can have a picture in there of a dog playing frisbee, but don't have giant dog and cat heads with staring eyes. That's threatening.
Yeah.
Hey, Temple, I know Letticia, there's a behaviorist that's part of this meeting, that she's from Oklahoma, the veterinary school there. And in their teaching hospital, their hallway features nothing but images, great big images of dogs, a dog's eyes. You know, sort of close up, so the whole thing's good on the hallways, all you see these eyes.
Yeah,
Well, you can have other pictures of pets. I mean, you could have, you can have a dog, playing frisbee or something like that.
yeah, I mean, it's been a battle now to take those pictures down. I remember the day they put it on. And that's when I had just started at OSU, Oklahoma State University. And it's been a big issue taking them down because they were donated by a client. They were taken by a professional photographer and donated, and there's like, so they don't want to break that client's heart by taking the pictures down.
Well, that's the problem. But the problem is that, staring eyes are a threat.
Yeah.
There's other pictures of pets that you could use that just don't have staring eyes.
Yeah, exactly. They're beautiful pictures to our eyes,
This
not
is
to
the
other animals'
problem,
eyes.
and maybe they could put somewhere else where the pets won't see them.
Yeah, that's one of my goals.
May I ask a question? What
Yeah.
is
The other thing that we saw in this vet clinic was a little shaky table that was was on a hydraulic lift and it shook. That's gonna be scary. The other question that comes up is, should the veterinarian be wearing a white coat? Well, it all depends upon how the animal perceives it. If the animal's first experience at that clinic and a white coat is treats and fear-free, then you should wear the white coat, because that's associated with good things. If the white coat's associated with being roughly held down, then you might wanna give this vaccine outside and not wear the white coat.
I want to
Animals, they tend to associate bad experiences with obvious features on people, like white coats.
Jimble, if I could amplify what you said earlier, is that animals' first experience of the veterinary hospital is 100% positive. Even if that pet comes back the same day or the next day, the first visit is 100% positive. So putting that into practice after Temple's visit to that practice in 2020 now, they'll come in and get some kind of a treat at the front desk, and then they'll go into exam room and get a treat, and they go back to treatment and get a treat. They go back where they might be hospitalized to get a treat. If there's other services, boarding or grooming, they get a treat. And so they also get a syringe that they take home that they make a positive association with. So it's got peanut butter on it and a piece of hot dog stuck on it, and easy cheese put on it, liver paste, whatever you want to put on it, but you turn it into a positive.
That's right.
Did you have a question?
Well, I just wondered what the future of pet food is. You talked about it.
Oh, of pet food?
Yeah, you said there's gonna be a revolution of
Oh,
change.
human food.
Human food.
Oh, human.
The animals.
The food,
Like
yeah,
the food animals living their best life. Yeah.
Well, I think the same thing, let's make, you want to do low stress handling. Let's say you go to a new cattle handling facility, it might be a good idea, maybe the first time they go in that facility, you beat them in it. You don't want to have the first time they go on a brand new set of corrals, doing something that really hurts. Sometimes you gotta do stuff that hurts, but it's really important not to have to be the first experience with a new person, the new corral, or the new four-wheeler, or some other new thing.
You've probably heard me say you only get one chance to make a first impression. Just one. I probably said that to you the other day, actually.
Well, and that's where to help advocate for your pet at your vet clinic is call and ask if you can just come in, get some treats, walk through the clinic, and then leave and call back to schedule your appointment. I mean, I think most clinics could probably make that work for you guys if you called and asked them, and that's one way it doesn't take much of their time, but it's got a big impact on your pet, for sure. Yeah. Go ahead. I don't know who's gonna say something. What we try to do at our clinic is we offer what we just call a positive experience visit. So if we have a new client call, we offer them to come in and do just that. Come in, one of our team members will take you around, give you some treats, get on the scale if you're not scared. The scale can be very, very scary. Go in the room, get some treats, do just like Dr. Becker said, walk through the clinic, meet the team, low stress, and leave. But then but then one of the things that we didn't talk about was social pressure. Do you wanna just talk about what that means?
Oh, yes. So this can happen in dog parks, pet stores, but also at the vet. Is they are dogs, a little bit less so cats in a different way. Dogs are very, very social animals, and we can put what's called social pressure on them. So some examples of that would be, you have a dog on a leash, your friend has a dog on a leash, and you're bringing them up face to face to meet. That is way too much pressure. That is not how dogs naturally meet. We are forcing them to put social pressure on each other. It's like if I'm coming to talk to Letticia and I sit way too close like this. Like, I'm putting pressure on her, that's gonna be uncomfortable, and if she can't get away, she might smack me, which is fair. We also do this at the vet a lot, where they are sitting next to their owner, and if you're me sitting on the floor, some people stand, whatever, and we're going, okay, we'll start the exam. All right, come on, Fluffy, come on, Fluffy, come on, Fluffy, come on, Fluffy, let's go, Fluffy, come on, Fluffy, come get a treat, Fluffy. And Fluffy knows what you want, but is too scared to do it, and that creates a huge conflict for them, because they understand, they know what that means. That any even moderately socialized dog knows what that means, because you do that at home, but they also don't want to. So then they get more and more and more nervous, because I'm supposed to do something, but I'm too scared to do it. I'm too scared to do it, and then you just get a shutdown.
It's like peer pressure with people, right? You're in a social situation where you feel like you should do something that you don't feel comfortable, and then you end up doing it, and then you don't really want it, and then so put yourselves
We just don't
in
generally
the
bite
spot
people
of your
because of
dog for 1 second, and you will be able to understand what it feels like to have a voice but not be heard, right? When they're communicating with you what they're feeling, but we are just not reading those signs because we're not paying attention, or we're feeling pushed to actually make it happen today. It has to happen today, but does it really? Do we have to accomplish all of this today, or we can go in parts? We can do some today and get them ready next time. Maybe they need medication. Maybe they need a little bit of a chemical help to facilitate that procedure, that interaction, that, trip, that car ride, because they're terrified of car rides. So think about how challenging it is to be a dog. It's like being a toddler. You're feeling all these things. You're a lot of things are bothering you, but you can't say anything. So you don't speak English yet, right?
An advanced tip, to give this all away for free today, is ask yourself, and we can help you, we don't expect you to know this after one session, is, was that growl, bite, snap reaction appropriate in dog language or not? Because human language, we think all bites are inappropriate all the time, no matter what. Dogs don't bite. My dog shouldn't bite people. He would never bite you. He would never bite you. I would never say that about any of my dogs. He would probably at some point bite, and that's fair. But here's what might be in dog language even inappropriate. As far away as you are from me, someone walks by and the dog runs to attack them. That's probably an actual behavior problem. The toddler trips and falls on the dog when the dog's asleep. Dog wakes up and snaps the air and doesn't make contact. In dog language, that's not wrong. They don't understand. They just tried to warn. In their mind, if they could think like we do, I was so restrained, I got surprised and woken up, and I was able to tell him to stop without biting him. And then we come over there and smack him. And they're like, what? Like, to them, that makes no sense. Yeah. Or the vet's looming over and poking and trimming the nails, and they're trying to give signals, and finally they just do a quick little punch on the arm. To them, that's not inappropriate. That's very restrained. The vet walks in the room and they leap and rip their face off, inappropriate. But because that's a way overreaction in their normal ladder. So, like she said, look at that from their perspective. Like, boy, I really tried hard not to bite you. What a good job I did. And we're like, no, Fluffy. Or, gosh, I was so good. I growled at that kid and asked him to stop instead of telling him to stop. And we tell him no. And then let the kid come over and hug him. They don't understand that.
Why do they label dogs reactive then? Because in my mind, they're not reactive.
Well, if you think about it, I think we take the term reactive into the wrong context, right? Yeah. Something happens and you do some reaction. You reacted to that. So now you are reactive to that. But that's normal, right? So are they being overreactive or are they being inappropriately reactive? So is that reaction appropriate for that context and that situation? If the answer is yes, then how can we avoid that situation in the future, right? It's like trying to take an x-ray from a dog for the first time. What do you think? Now try to think like a dog, okay? You're not a human, you don't know what an x-ray is. We're at the vet, so we went through that car ride already. We waited in the lobby for 5, maybe 15 minutes because people are late today. There's other dogs barking. We went into an exam room. There's a cold, tall table made of metal. We went on top of that table. We're afraid of falling. Most dogs are. A lot of them are, if not all. It's just natural, right? Then we got palpated. We had strangers putting hands on us all over the place. There's a cold little apparatus with a gel tip that was inserted in a certain specific area of our body that will never, I don't know one dog that likes that experience. There isn't any, and I don't think we would like that experience if that was the only way to do that. Many of us was hip temperature taking, right? So we got pushed and examined, and hands in the ears and lights in the eyes and open mouth, squeeze the belly, thermometer in the butt, and now we're gonna go to the back for an x-ray. So now it's a different room with a lot of clinky noises and, you know, weird lights.
Away from mom and dad.
Away from mom and dad.
On a cold table.
Yeah.
On a cold table, I'm being abducted by aliens. That's the only explanation
Who are wearing
for that.
a lead shield, lead gloves, and a lead apron
Yes,
with
So-
in a dark with a light shining spotlight.
exactly. Now there's a noise. Zzz, boom. There's a big metal, like mechanical noise that happens, right? So why would we expect a dog to not react to that? And actually take that easily. Oh yeah, sure, it's just an x-ray. Let's enjoy this. Since when? Now just add pain to that picture. Why are we taking an x-ray in the first place? Just because it's fun? Or because somebody part hurts?
Yeah.
So now we're in pain. So now there's pain and fear. Who do you think is going to win? Reason or pain and fear? The dynamic duo, right? Very easy to understand why that dog will escalate and bite. So what's the alternative?
Sedation.
There we go. That's what drugs are for. To help facilitate things. Does that dog need to be part of all that? Does
No.
it need to be awake for all that? Do we have time to desensitize them to the X-ray room?
So I want to figure out her question.
Uh-huh.
So when does reactivity become a problem? Because we hear people talk about reactive dogs
Mm-hmm.
and as problematic.
Yeah.
So I mean, everything you're describing obviously is perfectly appropriate.
Mhm.
So where does it become a behavior problem?
Mhm.
Do you know?
Yes.
When it's not appropriate,
When
right?
it's not appropriate and they're anticipating that event. So I've been through that event, it was traumatic, I know what happened and I remember. Now I see something that resembles that procedure or resembles that situation and I already start reacting. But it's not happening yet, and maybe it's not going to happen, but it resembles that situation. It takes me back and I think it's going to happen. So you know what, let me just bite, because that always works, right? And then I'm sure nothing is going to happen. Whatever it is, it might be a good thing. But whatever it is that's going to happen, not happening anymore, because I already bit. I took care of the situation.
Let's take
I
it out
have
of
a reactive dog.
to take it out of the vet context. It's like, okay, I got attacked by a dog and that really sucked. And now I see a dog that's walking by 2-3 blocks away, not looking at me, walking the other direction on a leash, and I start freaking out. That would, in my opinion, be considered a reactive dog.
It's called
When
memory.
another dog is charging at them and they react, not a reactive dog.
Mm-hmm.
That's just a normal
You
reaction.
had a question.
Yeah, are we not worried about cumulative effects of sedation? I'm just curious. about
So,
that piece.
I mean, the short answer is no.
No.
Not really, because if we were doing it every single day, then probably. These are like once a month, a few times a year. I mean, this is not an everyday thing. We use a lot of things that are quite safe and reversible and short acting, not really a general anesthesia kind of situation. And what I would worry about way more is the cumulative effects of stress.
Yeah.
Because that tends to accumulate and be much more of a poison to the body than most anything else we could give them. And that's been a real mindset shift for us in the industry, for pet owners, for a lot of people, that stress is way more toxic than any of these and way more cumulative than any of these. So thinking of it that way,
Kind of
gosh.
becomes a new normal for the
it's a new normal, but then every time, you know, we do a nail trim and they don't like it, that's 3 days of stress versus 2 or 3 hours of being a little, you know, being groggy or sleepy. It's just, it tends to be much worse for them.
Yeah, some animals are able to show discrimination, right? So I know this situation happened, I will only be anxious in this situation if it presents itself again, right? But a lot of animals actually generalize one bad experience to the next. That's what we call generalization, right? It was bad here, and that kind of looks like this, but you know what? Just to be safe, let's go and be bad right now, just because, you know, let's just make a point about this, because I don't want to even have to deal with whatever that is, and it has nothing to do with this actually. But in some sound, image, light, odor, all of those things that resemble that bad, and those are senses that they have way more accurate than we do, right? There are a lot of things that they can perceive that we cannot. Shadows, I mean, different sounds, different volumes, different voices. Those are things that they are listening and hearing all the time and, you know, making memory of it that we are not.
Your pheromones.
Pheromones.
If you're nervous, they know.
They smell cortisol in you.
Yeah.
And testosterone levels in men. I'm not saying testosterone is bad and men are bad. That's not it, right? We're talking about physiology from a dog's perspective, a dog's nose perspective. Dogs have such a powerful nose that they can detect cancer cells in urine samples. You know the difference between your nose and a dog's nose? You have a mere 6 million cells in your nose communicating with your brain. Dogs range from, depending on the size of the dog and the size of the nose, 140 to 240 million cells. So now compare our pathetic 6 million cells with dogs' 200 million cells. Can you even appreciate the difference? No. Even if you would like to, if you want to, with the best intention, you cannot even appreciate that. They can smell things long before they even happen. So just nose alone, odor, is a huge stimulus for them. And they will make odor associations all the time because that's how they relate to the world. We are visual people. They are olfactory animals, right? We're more visual and tactical. We have to see and touch. All they have to do is smell. And they know what's coming long before they saw it. Make sense? Yes, you have a question.
So is there something that fear-free practices do as far as odor? Is there different cleaners or things? Because, you know, you walk into an event, you usually can smell that.
Yeah.
Yeah. Tell us what you do. Yeah.
We,
what you
yeah,
take it.
yeah, we do. We use a special cleaner that is supposed to help get rid of that odor, but we also use lots and lots of cleaning all the time, very thorough cleaning, which you would expect from a clinic, but maybe to a higher degree is what we should be doing. And we use a cleaner called Rescue, so we clean very thoroughly each time, and we never take a patient into an area that has not been cleaned, really under any circumstance. And then we also have pheromones, so there is a cat-specific pheromone and a dog-specific pheromone that mimic mom's pheromones, and it just has a calming aspect to that. So at fear-free certified clinics, you'll see there's diffusers plugged in. At our clinic, you'll get a bandana. It's cute, but it's actually sprayed with these pheromones to help calm them. We don't have dogs on the same side of the clinic as the cats because that is also another sense of smell that is not appropriate for them.
And we do everything in the room.
Everything is in the room, so they're not, you know, and there's blood. Obviously, some things are very bloody, but immediately the priority is we have to get that cleaned up immediately. We don't have other patients around other patients so that they're not smelling those things. But it's just lots of cleaning, lots of wash machine stuff, lots of pheromones.
Mm-hmm. And just not taking your pet from location to location.
Right.
You know, they're gonna be in the room, not in the back where there's other patients maybe in kennels or that walked through. I mean, just really minimizing the amount of places that they go.
Well, and like Temple was talking about, if you have dogs in cages, they're smelling what is happening there in the treatment area. You can't, it's hard to keep them from smelling that, right? Their odors, their noses are strong. And if you're doing something right there at the table and you have those kennels right there, and some clinics are set up that that's just how it has to be. We get that. So there's curtains and they probably try to cover up the smell the best they can, but it's really hard. So when you have 2 patients in the same place, it makes it really hard to cover up those smells. The garbage cans should be covered. All of our garbage cans are covered so that smell is at least contained somewhat. Any urine or feces immediately goes outside because they can smell that. The bloody stuff needs to go immediately into the laundry room so that we can get it right in the wash machine.
Laundry's covered.
The laundry bin is covered. So there are a lot of things if you're willing to take those steps to do it, which is where, as a veterinary industry, we are also behind. But that's why we are looking to the community to start going into your clinic, groomer, whoever, and talk about these things. Okay, would you mind if I didn't walk my dog in the front door and I stayed out in the car, and could you guys call me when you're ready for me? My dog gets really stressed in the lobby, right? We've all walked into a lobby where there's lots of smells and sights and lights, and it's all just very, very overstimulating. And then could you possibly do as much as you can with my dog in the exam room and not have to walk them down the hall through the doorway that they might be scared of into the treatment area where there might be other pets? Those things are all very scary. And so we're actually looking to the pet owners to start to ask for these things at their clinic, because some of these things will be very easy for them to participate in. Yeah.
Baby steps.
Baby steps, yes, for sure. Yeah. Did you have a question?
I did, but it was circling back to the topic we were discussing previously.
Sure.
And I'm just curious if you had any tips to help a dog that might have been jumped. I was walking my dog out on a leash, and we did get jumped out in the woods by a couple of dogs. And she's a golden.
Yes.
Dr. Megan knows her.
She's
She
so
loves
cute.
Dr. Megan. And we just can't say enough about your clinic. We just love it. But I just sometimes, we don't go to that place anymore. We go to other places, even though that place was a leash-only place. This happened. And just this morning we were out on a walk, and a man was riding his bike with his Australian Shepherd, trying to tell the dog to heel, and it wasn't. And it got close to Gracie, and I could see her, I was trying to just let her know, I got this, you're okay, and get between them. But I can still see, I feel like reasonably that experience for her will always be there when she's approached by a dog.
And it probably will always be there to some extent, just like any kind of trauma, but I would try to walk somewhere where you can create space. And then if you see that coming, just create a bunch of space, because then she's gonna feel like, okay, mom's got this.
Okay.
Like you said, she's got this. And just make somehow, like if they're coming down, just cross the streets. It's hard because some of these places it's hard to walk and make space like that, but just kind of thinking that, because that's what she wants. And then she'll feel really, really seen if you do that.
Yeah, so you have, this is what we call threshold, right? So threshold is that it's an imaginary line, right? Up to here, you can come. If you go beyond or, get closer to me, that's when I'm gonna start getting anxious. Each person, dog, we all have a bubble, like a social bubble. Right. Each dog has a different threshold, right? Your dog may start with a 50-yard threshold. And that's where we're gonna start, but now you're paying attention. Is your dog showing the signs of stress just from seeing that other dog coming from the other side? Yeah, so that's not, we're invading that threshold line. So let's increase it a little bit. Maybe it's 60 yards, maybe it's 100. And then slowly, as we reinforce calm behavior, we're going to decrease that threshold line until your dog can tolerate at least passing by the other side of the street, right? They don't have to necessarily interact, but at least can continue walking without being stressed by the presence of another dog. There's also on a leash. And you're gonna hope that that event doesn't happen again, right? And of course, that's what we try to do, right? But respecting each dog's boundary or threshold.
And carry a big stick. Because if you have an off-leash dog, I have little dogs, but it doesn't matter. If I go out walking somewhere that's not like a fenced and stiff spot, I carry a big stick.
I carry citronella spray.
Just to keep them, and I've had to use it before, and that way I'm not hurting another. I don't want to hurt anybody. I don't want to hurt the other dog. It's likely not their fault either, but I can just push them away gently and make that space, and then usually that gives the owner time to come get them.
Unfortunately, there's a lot of off-leash dogs. I know that Kayla and Braden probably have some things to say about that too, if you guys want to go talk with them afterwards. And it's hard because the guy might say, oh, he's fine, like my dog is fine, he won't hurt your dog, but you don't know that my dog on a leash might not be fine.
And that is when you start
You don't
telling
know.
lies.
Yes.
Oh, mine is sick, you might wanna pull your dog back.
He will bite you.
Or he will bite you, he's
He
not
always looks
friendly.
Yeah. You know what's funny? It's going back to culture, right? In some places in Europe, especially some countries in Europe, all dogs, doesn't matter what size, what breed, all dogs walk outside in public wearing a basket muzzle. Are you guys familiar with basket muzzles? It's just a little cage, and that's part of their gear. It's walking gear. We're gonna walk outside, we're gonna wear gear. So the harness, the collar, whatever, and the basket muzzle. So they can open their mouths, they can pant, they can drink water, they can be fed treats through the basket muzzle. It's just gear. No dog perceives that as punishment. I was like, oh my God, I'm being punished for something. No, we're gonna walk outside, we're happy to see the basket muzzle. Every single dog walks on a basket muzzle. What's the incidence of bites?
0.
I can't say 0 because probably that's a radical number. A muzzle can come off, or they can even have bad encounters, but then the actual bite is not going to happen, right? You can get bitten if you stick your finger in through the mud. It can't happen. So probably the bite incidence is not 0, but it's so low that it doesn't really, doesn't generate statistics. So imagine if we had that culture here, which is we're far away from it, right?
We can't even get them to wear a leash in the US.
Exactly. Imagine a basket muzzle, and that's just preventive safety measure. That's all that is, right? And you will see like tiny little thingies, like dachshunds, wearing a tiny little muzzle, cutest thing, and they're pink, and they have, you know, I don't know,
Bedazzled.
the bedazzle, yeah, they're the cutest things, or they have their names on it. I mean, it's super cute. Every single dog wears a basket muzzle. We don't have dogs in the yard because they were attacked, you know, by other dogs, or all of those things don't happen. Now here in the US, we have an average of 4.7 million dog bites reported every year. 85% of the bites reported are dog bites. About 10% are cat bites and 5% are human bites, actually. We bite too, but it's not that big of a deal these days. But I mean, it's a serious problem. I mean, aggression and behavior complaints is the #1 reason dogs get euthanized and surrendered to shelters every year. And the numbers are not getting better. They're getting, you know, larger, bigger, worse, because we have more pets today than we did 10, 15, 20 years ago. So the pet industry is increasing exponentially. We're getting more animals. This spay-neuter, you know, culture that we have is not solving population issues, right? Population control. That was the goal of that. But we've been spaying and neutering for the last 30 years now, and the number of dogs just keep increasing in shelters, in homes, and everywhere. So we're not solving problems.
COVID didn't help that.
COVID didn't help. It increased actually about those, you know, from those 4.7 million dog bites reported, 1% require hospitalization. Out of those 1%, we have an average of 40 fatal attacks a year by dogs. COVID year, it was the highest number, 70 fatal attacks we had that year, that post-COVID year, right? So 2021, we had 70 fatalities. Most of the bites happened towards children between 5 and 9 years of age. Most of the fatal attacks, 0 to 2 years, the toddlers. So it's a harsh reality. You know, if we think about it, if we go look at statistics, dogs now, they used to be #4, now they're #5, top killer on the planet. I'm sorry to give you statistics like that, but I have to be real. I have to tell you what the numbers are, because if we know what the numbers are, then we work around it and we work to get things better, right? So it's really sad.
And a lot of those dogs probably gave a warning.
Oh yeah, they all say no.
If not in that moment, then before, and we're punished for it, and now learn that biting is the only thing that works.
Yeah.
So it's important, right? I mean, dogs are man's best friend. Why do they make top killers? What's happening? We're talking about global statistics, right? It's not here in the US. I'm talking about out of all animals out there. #1 are mosquitoes. #2, men. #3, parasites. #4, snakes. #5, dogs. Talk to a liability lawyer, you're gonna hear a lot about it. The insurance industry has increased its, you know, has changed the way they do insurance now because of the statistics on dog bites. It's a huge industry today. We moved from breed-specific legislation. You guys remember hearing that back in the day?
Mm-hmm.
Some breeds were banned. Now we're not dealing with breed legislation anymore. Now it's everything, you know, up or above a certain poundage, like 50 pounds, not allowed in the community area. or in a, apartment complex or someplace.
But instead of that, what if we just prevented their stress so they didn't need to bite?
Read their body language.
Read their body language, that they wouldn't feel like they needed to bite you.
The fear-free training at daycare facilities and boarding facilities, and because we have dogs brought in every now and then, like I just came from the doggy daycare and they got into a fight, right? They're not getting trained on the body language of these pets, and we have that's what's in the resources, is we have some handouts in there so that you can kind of learn a little bit more about body language and what we call a fear, anxiety, and stress scale. But dog parks, right, everybody's off leash. Sniff spots has become very popular, where you can go and rent the space for just your dog or your party of dogs, and those are great places. They get to sniff around, which is very enriching for them. All the dog smells, but they're not there with the other dogs, because all those dogs together plus all of those smells is a recipe.
Plus
a good one.
a bunch of, more than likely, people who can't read body language or aren't paying attention, or the kids took them, or who knows what, or it just takes one dog to ruin that whole, it's not the dog's fault, but it just takes one dog to ruin that little groove they've got going on. One, or even just play styles that don't match. It could be as innocent as that. A bunch of, poodles who want to play chase, and here comes a lab who wants to wrestle, and they don't like that.
Not to mention too, the dog parks, you're not building a relationship with your dog. You're sending him there to play with all the other dogs, and it has nothing to do with you, right?
Yeah.
Anymore. So now your dog's like, okay, this is fun, you're not.
Yeah.
Okay, so,
Yeah.
there's a lot.
But fear-free is our strategy,
Yes.
right? But we need to change the culture.
Yeah.
How do we change that?
Huge.
Yeah, we hear that from naysayers more in our own community than in the public all the time. Other vet clinics, and I'm not trying to denigrate anybody, but I do hear this all the time. You don't scruff cats? How often do you get bit? Never. We don't let it get that far.
Let's talk about cats.
I would love to talk about cats. Our poor cats
We have
are,
some cat owners in the room.
yeah, our poor cats are who in general tend to be the second class citizens of the pet world. And if I have some cat lovers here, you're probably thinking, not my cat, that is accurate, but in general, they tend to be. They are unique because your fear-free battle with cats is won or lost before they even get there. It's won or lost at home when you put them in the carrier.
Or not get them in the carrier.
Or not. Or not. But, and then that is the tone of the whole appointment before they even walk through the door. Because if you, like Letticia was saying, put yourself in the cat's shoes. I'm an indoor cat. This is my domain. I never go anywhere, which is fine. I'm enriched at home. It's great. I have a great life. Suddenly, once a year, out comes this weird box from the garage that's covered in mothballs and dust and who knows what. We blow it off. I'm grabbed and put in this weird plastic box. Now I'm in the car. What is this? I don't know what this is. I don't ride in things like this. I'm not a dog. This is weird. I'm screaming the whole way. I don't like it. I'm nauseous. Then I get there, wherever there is, there's barking dogs. I'm swung in like this. I'm carried in the clinic. There's weird noises. There's weird smells. Now I'm pulled out, put on this cold table. I'm a cat. I don't like stuff that's cold. I like blankets and sunshine. And then I'm poked and prodded and then yeeted back in the carrier and taken home. And what was that? Talk about an alien abduction. So step one, and this is so easy, is you just get a nice looking, attractive carrier that you don't mind being in your house. Sleepy Pod makes a great one. There are also dupes on Amazon that are cheaper than Sleepy Pod that are great. Get one that opens several different ways so that when they get to the vet, if they're still not sure, we can examine them in their carrier. And just put a fuzzy blanket in it. Cats love fleece. Put it in the sun. Just leave it out all year round.
Spray some pheromones.
Spray some pheromones. Put some treats in there if they like treats. It's out all the time. It's their safe space. That does two things. Number one, it removes that carrier battle. And then number two, when they get to the vet, they have a home base. Cats are just really territorial in kind of a different way than dogs. In that, like, this is my home territory. This is where I'm safe. And if I'm out of it, they can barely even recognize you. It's not even that you don't comfort them. It's like you think, oh, my cat doesn't love me. Your cat doesn't even recognize you. You don't smell the same. You're a pod person. I don't know what's going on. We're both in danger. I don't know what you're doing. I just need to go home. I mean, how often, for those of you who have multiple cats, You're pair bonded, they love each other. You take one to the vet, comes home and the other cat's like, absolutely not.
Hissing, yeah, hissing at each
Hissing,
other.
growling.
For 2 days.
I thought I was above that. Like, no, my cats are actually pair bonded. Took one to the vet, came home, sister sitting up on the cat tree growling at him. That is not my brother. That is a pod person.
Smells funny.
Yeah.
Absolutely not. That's not. He's just sitting there like, hello, and she's like, mm-mm.
No,
I had to.
You're possessed by something.
Yep.
Yeah.
Then I took them both back to the clinic, and then I took them both home, and she was like, "Oh my God, hi," because they smelled the same again.
And we do have clients that when one cat needs to be seen, the second one will just come with them,
Yeah.
because it is easier in the end for them to do that. Just on Friday, we had a cat that had to come in for the day, and she brought both of them. Like, it made it easier than to go be reintroduced back into the home.
It's hard. Their shared scent is very important. You can speed it along if you have to, if your non-fear-free clinic or ER is like, then you can brush them with the same brush. You can switch their blankets. I mean, you could spray Feel Away all over the place. Feel Away also helps recreate a shared scent. It's just that kind of neutral pheromone that makes them smell similar. So there are things that you can do, but if you have a cozy carrier, it is most of the battle. Or they love their carrier, they get to the vet, they're still upset. Great, we can sedate them in the carrier. They don't even have to leave the carrier. If your cat is particularly anxious, get a soft carrier, because then we really can give them medications right without even having to take them out.
I have a backpack and she loves it.
Good.
So she actually hides from the dog in the backpack when they start chasing each other. So
See, you can attest to it then. It becomes their safe space that they'll go back to if
Good.
they feel like they need to hide from
Did
something.
you have a question?
Oh, yes, I just started cat sitting for a place called Meowville, and I was just wondering if you had any tips of meeting new cats if I'm coming into their territory.
Did you ask the question on the
Yes, in the email.
email? Let me find it, because we did have notes on this. Okay, yeah, I had a follow-up question to your question. So are the cats coming to your house, or are you going to their house?
I'm going to their house.
Okay, so if they're in their own house, setting up, even though it's their own house, setting up an area similar to if they're a new cat in a new house. So have the owner leave them in and they don't just stay in there, but having a bedroom with a cat tree and a litter box and some beds and some food, and then just having a smaller space, because any kind of smaller territory with all of their resources is automatically gonna feel safer, because when cats get overwhelmed, they just want to have that small safe territory. And then they could leave the cat in there, and then you could sit in the living room and open up the door and let the cat kind of come out to you. You'll notice probably when you start doing this that cats will explore, if this is their safe space, they'll explore its bigger and bigger and bigger circles, but going back to that home base, and then they can get used to you. Or if they're not ready to get used to you, great, they're in there with their food and their litter, and they're safe, and they can come out when they're ready.
And I would buy my own pheromone spray.
Oh, yeah.
Little thing,
Mhm.
and have that in your purse. So before you walk in, 30 minutes before, I would spray that as if it was your cologne. It doesn't really smell good. I'll let you know. I hate the smell of Feel Away. But I use it no matter what. I mean,
It dissipates in a minute.
It
It's not too bad.
dissipates, but it's at first the smell is a little, not that,
It's like alcohol.
choke a little bit. But,
Yeah.
but it goes away. And then I would, before I go in, I make sure I have pheromone on me. Because you're making that, you're bringing scents from outside, right? Sometimes from your own pets. Or from another house that you just pet sat, and now you're coming to another house. So you want to have that neutral scent on you.
And you can get that on Amazon.
Oh, yeah.
There's different kinds, but the one we use is called Feel Away.
Yeah.
FELIWAY. Works well.
Yeah.
I've heard that a lot of the generics don't work as well. I don't know. So I would get it anywhere you want, Amazon, Chewy, but get the brand.
Get the Feel Away brand. Yeah, get the multi-cat. There's 3 types. There's the basic, multi-cat, and Optimum. I would get the multi-cat.
I think, didn't they combine them? I don't know.
No, the
they still
Optimum is
have-
the 5 fractions, but that multi-cat is still better for multiple different cats. Yes. Yeah.
What's the dog equivalent?
Thunder Ease.
Thunder
It used to be
Ease.
called Adaptil. Now it's called Thunder Ease.
Or Zenidog. There's 2. Zenidog comes in a gel form and in a collar form, and then Thunder Ease comes in a collar form and a spray form.
And then a diffuser.
And a diffuser, plug-in, but it's a plug-in.
Yeah.
So we have 2 brands now that we can actually trust, and there is a research article that actually compared the 2 brands, and they're equally effective.
Mm.
So you can use Zenidog or Adaptil depending on, or Thunder Ease, depending on what you need it for exactly. I like the gel one, cause you can take it in the car. So for car rides, the ZanyDog gel.
Oh, the lid comes
Yeah,
off.
the lid
Okay.
comes off, it diffuses, it's mobile, you can take it to rooms in the house or to the groomer or in the car. Then the plug-in just lives in the house, cause you have to plug in, right? And the collar they wear at all times. So the collar is also very effective, cause it's with the dog all the time, right? You just replace a new collar. The spray is really good for things like the carrier, the car, you know, the leash, you know, things like that. You spray on, and it doesn't last long. It's after 2 hours, you have to spray back again. So it's not you spray once and it's good forever. No, you have to continue to spray.
Can I circle back to cats? There was one thing I wanted
Yes.
to say about cats that I forgot. Don't let anyone scruff your cat ever, at all,
Ever again.
ever again, unless they are younger than like 5 weeks old. Little tiny kittens, they're used to it. Mom picks them up, whatever. By the time you get the cat, no more scruffing.
Yeah.
They just, some of them do freeze, that's true, but that's a stress freeze response. They've grown out of that little tiny baby when you pick them up and they think it's mom. That's like 2, 3, 4 weeks old. Not even like a kitten that you get at 8, 9, 10 weeks old. It just floods them with stress hormones at that age because they feel like the other time they get held like that is when they're being pinned down by another cat fighting.
Yeah.
So at older ages, it feels more like that. And that's just a difference in stress response. Some cats shut down and freeze, they're still feeling it on the inside. Some will lash out as a way to get you to stop.
So if I go to the vet with my cat, how do I advocate to the veterinary team for my cat that they look like they're gonna scruff him?
You say, it's not 1990. What are you doing?
Oh my gosh, how silly of me. You're right, let me get a towel.
In all seriousness, a towel wrap will do the same thing to block any of their pointy parts, but it's comforting. They like small spaces. They don't need so many visual triggers that stress them out. They like to be cozy. They like to be warmer. Generally, they're desert animals. They like to be wrapped in a towel. They like to hide.
Not have to deal with it.
There are cat bags on Amazon that their head is out, so you would still need a towel, but it just kind of swaddles them up. You could bring them in that because you just wear them like a purse. I wouldn't recommend that. That's what the picture in the listing is, though. It's just someone just wearing their cat's just happy. They don't generally love that, but you could bring them in
If you
their
brought that
cat
with
bag.
you.
If you brought that with you, ask for in advance if this is like your regular vet, not so much of an ER situation. Ask for calming meds in advance. At the ER, just ask for them to give them something. Even if they are very fragile and very sick, there is something they can have. We don't need to go too deep into pharmacology, but there are so many different combinations and drugs and doses for sedation that there is something they can have.
Because even at a very old or compromised age, the stress is going to be more detrimental to them.
I'm way more worried that my respiratory distress cat is a great example when I hear from other vets a lot. What if it's a cat in respiratory distress? I'm worried they're going to have a heart attack and die.
Yeah.
I am way less worried about giving them a little bit of an opioid so they relax and they're still awake than pitting them down and stressing them out. They're going to die if you do that. I'm way more worried about the stress effects on them than just about anything else.
I just think all cats should have prevent visit medications. I do that with my cat. I have a cat. He's not fractious. He's not reactive. He's not nothing. I vaccinate him myself, and we have a ritual. He gets the churro. While he's licking the churro, I'm massaging his butt all over, which I massage every day. I do the ritual, and then I pinch his skin and use like a hypodermic needle, like a very tiny needle, and vaccinate him. And he's like, "What? Oh, but there's churros." So that's the ritual already. And if I have to take him to the hospital for anything, a blood draw or anything, he's gonna get his pre-vet visit medication. I'm not gonna wait until my cat becomes a reactive cat and now I have to medicate my cat. That's just me being proactive. So before I give him an opportunity to make a bad decision, I'm gonna take care of that problem before it even existed. And that's what I do with my clients. It's like, you know what? The vet visit is going to be stressful, no matter what. If we have this little chill pill here before, it's gonna make it much easier. We're not gonna perceive the sounds, all the lights, all the odors, all the everything. You decrease the amount of stimulation that they're getting in. Just make it a lot easier for them. I just think that, probably 90% of the cats should be pre-medicated.
I make them do that to me at the dentist. I don't care what they're doing.
I was just gonna say.
I don't care what they're doing. This is a recheck. They're just asking me questions. You better get that Novocaine mask on me. Like, we're not doing that. Absolutely not. Because I feel like the stress on my body and mind is worse than whatever little bit of gas they want to give me.
Speaking of teeth, that was perfect because our vets have told us that we need to start brushing our dog's teeth like every day. I have an older Chihuahua who has just a few good teeth left and we're trying to preserve them. But it is such a battle. I mean, we just, and I feel like a bad mom because the only way we do it is like get him in a, turn him upside down and, it's just really stressful. And so it's like, okay, well, we either, you feel like a bad mom because you're not brushing their teeth, or you feel like a bad mom because you're holding them down and making them stressed.
What does he really, really like? Is he food motivated?
Well, yes, but he's also overweight, so it's like, we can't give his, the food, yeah. I mean,
We'll get like a little bit, just like a little bit of potted meat. Is disgusting. It smells so bad. You're gonna be like, are you kidding me? It's so gross. Just kind of dip the toothbrush in it a little bit and just hold it out to him and just let him lick it and chew on it. Just no big deal. I'm not gonna force you. If you don't want to, okay, but then you don't get any of this at all. Just toothbrush, potted meat, let him kind of chew on it. And then you put a little bit of it, get like a toothpaste flavor that he likes and just kind of slowly start doing this. Let him chew on it. Anything is better than nothing. Or forget the brushing and just give him a greenie every single day. I know he's overweight. You can cut back his treats or his food or something, and do like a chew instead, depending on which teeth he has left.
Yeah. And we have the greenies we've been doing. I didn't know that was as effective as brushing. Or,
It's not as effective as brushing, but it's way better than nothing and balancing out with the stress. But try putting something ultra delicious on the toothbrush and just letting him chew on it.
Yeah.
And if he won't let you hold it, just let him take it and chew on it for 10 minutes and then take it away.
Okay.
Trade him something else for it. It's because even if you have to keep doing it with the potted meat or whatever and a little bit of toothpaste, the mechanical action is the best part.
Got it.
And just make it be like his choice. That's how you do everything with cats. You just make it think it's their choice. Chihuahuas are like cats. I have a mostly Chihuahua. It's like a cat.
Sweet.
So let's talk a little bit more about advocating for our pets at the vet or anywhere.
Or anywhere.
The groomer.
Yeah. This is a great, you want to start this one?
So what we like to say, because we do try to put a lot of stuff out there for the community about how you can go to your vet and advocate for your pet. And like we kind of talked about a little bit earlier, there are things that you guys can do. If your vet is not to a point yet where they want to participate, there are definitely things that you guys can do. So the one I said earlier, so for us, none of our clients walk their pets in the clinic. Everybody calls when they get there. We come out and get you guys because we make sure it's clear and our room is ready. We get you on the scale, we go in the room. Cats, it's a little bit different because where we want our cats to come in and acclimate to the room for a few minutes because, again, environment, that's good for them. That is not true for dogs. Dogs are less stressed staying in their car and then they can go in the room and when we're ready for them. But have your vet just ask, can I just stay out in the car? We talked about the pre-visit medications. Pre-visit medications are, so our patients that are higher stress, our clients understand that they need to take those medications. The ones, so it's on a scale from 0 to 5, 4s and 5s, 5s will bite you, 4s could be pushed to bite you, and it kind of de-escalates from there. But we try to give pre-visit medications to our FAS 2s and above, our stress levels 2 and above, which can be hard for some of our clients to understand that because to our clients who don't understand the body language, they look like their dog is having just a fine visit or a cat is just having a fine visit. But ask your vet for medications. There's lots, I know you asked about sedation, but there are lots of different protocols for tablets that can be given as well that aren't going to just fully put them sedated.
And then if they need sedation, it's less.
Yes.
It's less of the injectables because one thing that does seem to really make them probably a little overly sedated, now we reverse them and it is okay, is when they come in with nothing and you have to get them over this stress kind of hump to get them calm, that takes way more medications, which they're still quite safe, but it does generally take more than if they come in with the edge taken off and maybe they just need a little bit extra, then it's less sedation and they are less sleepy at home and they recover faster and they also recover faster at home if they can go home and sleep it off, even though I realize if you don't see it every day, it can be a little disconcerting to see your dog or cat cats sleep anyway. Most clients don't even notice that they're extra sleepy because cats sleep so much anyway, but to see your dog be extra sleepy, but it's really good for them. And if you think of when you had a really stressful time and you just got to come home and just sleep it off, it's better.
You can buy the pheromones like we talked about and use those prior to going to the vet, spray your cat carrier, spray the leash, get them their own. There's lots of, we just cut bandanas out of material, but you can buy them and just spray them every time before they go. Making sure the lobby's clear that when you do go in there, if at all possible, sometimes seeing the patient outside. Not every vet clinic is set up to do that, and sometimes we're on busy roads and things like that, so it's not gonna be an option, but if it's an option, ask for that. We have patients that are scared to come in the front door. We might bring them in through a different door because that door is very stressful for them. And then once you're in the room, just again, advocate for not scruffing them, not holding them down. Actually, could we get him something before he gets too stressed out? Getting yourself, so for our puppies and some of our regular patients that are extra stressed for this, but the tools that we use are very stressful. The syringes, the stethoscope's a big one. She talked about rectal thermometers. We try to use ones that just kind of take their body surface area temp. We send those home with our puppies so that they're working with those, so our puppies are coming back not scared of that tool, but just learning your dog's body language and asking for those things when you go there. That really takes a lot. They don't have to really do anything or change what they're doing for you guys to still be able to advocate for your pet. Yes?
So in order to get the medication before we bring them in, do we just call and you send a prescription?
If you were our client, we would have you have to be established, right? Because legally under Washington law, we can't prescribe medications without a relationship with that pet. So if we've seen you, so what we do for all of when our clients schedule, we're like, okay, we'll get your pre-visit medications, call you when they're ready, and we get them ready a couple days in advance. You know, we have some patients that come back every month for one reason or another. We just send them with them each time they come in.
Ask for a hands-off visit. My dog's real stressed. Can I just, you know what? Nothing's wrong with him. I just want to get established and get a supply of your favorite pre-visit medication that you think he needs for me to have at home.
That would be my first visit then, so that it's a good experience.
You would have. So when we have a new client patient that comes to the clinic, we don't know that pet, right? We might be able to, sometimes the clients are calling us because we're fear-free a lot at this point. So they're like, he is very stressed, where you're probably not going to be able to touch him, which is great for us, right? We know that going into this appointment that we're not going to be able to do anything. Dr. Megan does a visual exam, which is good enough for us to be able to give medications for the next visit. And if you are established with your vet, you should be able to call them and talk to them about that and ask them if you could have some type of medication for that.
Because really none of us, some of us less than others, but really none of us got into this business to cause pain and to cause stress.
This is how we learned it.
It's just how we learned it. And so, and some of it is coming from they want to just get it done. They want to just get it done, whether that's coming from internally, from them thinking about all these appointments, whether it's coming from client pressure, whether it's just the culture of how they were taught, they just want to get it done. So taking that pressure off and telling them that, hey, I actually want it like this way. I don't care if he gets his nails trimmed today. I just wanted to have a good visit. Most of them will do that. If they won't do that, I would find a different vet. Because I would say probably 80 to 90% of them, if you are driving it, will do it.
Yes, if you come in, I agree
if
with
you
that.
have a vet who won't even do it if it's your idea, I would switch. But that's not going to be your experience with most of them.
Yeah.
Most of them, even if they won't learn from it and do it for others, will do it for you if you ask. The ER is a great example of that. Look, we have all these emergencies, you want to get it done, but if you ask them to sedate, they probably will.
Yeah, it's an offer and demand kind of thing, right?
Also, talking about the metal table, would it be okay with most vets if you took in something yourself?
I think so.
Yeah.
Again, like that's a great example of it. They're not going to provide these things, but if you do it, they should let you.
Bring a yoga mat. Bring a yoga mat.
That's what I'm thinking, something
Yep.
that's soft and we feel a little more
Yep.
grip.
And we've used yoga mats before.
Would that be upset generally if you asked if they could just go ahead and do the exam on the floor?
Yes.
I would ask. You should ask.
I would ask.
That would be the best.
Yeah.
Yes, that's what we do. We do floor stuff
too.
a lot,
Mhm.
yeah. I mean, I don't have an exam table in my room, I have a counter that if I need to draw, if there is a specific procedure that I need that's normally with the cat, I have that counter that I can use, but I don't put them on, I don't even have a table in my room. Everything's on the floor or on my lap. So if everything that is tiny goes on my lap and they don't know they're having an exam because it's just, I'm just hugging that dog, you know, it's a massage session, I'm palpating the spine, I'm palpating the belly, you know, caressing it, talking to it. It doesn't know it's being examined, it doesn't need to know. Then suddenly my stethoscope shows up magically. And you know, like I don't show it, I hide it in my hand and I go under, oh, here's the heart. Wait, auscultate, let go. Let go of the pressure. Auscultate again, let go of the pressure. And we're talking to them at all times, right? Have a stick with peanut butter or spray cheese or whatever their drug is. I always have it. Have a buffet of options. Every dog has a price. So I don't have like Milky Bombs. I have all the, you know, 20 different things, and I have some of my dog patients that will take a churro. Like a cat treat or something. I have
Little
baby
dogs
food,
love
I have
churros.
tuna, I mean, you name it, I have it. So they have a stick of that here that my nurse is offering them. They're licking that, and I am doing my exam. My exam is done really fast. In 5 minutes it's done. I'm feeling the patella, I'm, you know, looking at the tail. So I'm doing all those things without the pet knowing it's being examined. It's just a play session, then I let them go. Okay, go decompress. They pant, they walk around a little bit, and then they come back because, hey, I got that good stuff that they want, right? And they come right back and I was like, come in. They jump back on your lap. That's it. Now, big things that I cannot lift, you know, the 60-pound, 70-pound dog, that's gonna be on the floor. But then I'm right there on the floor with them, and it's a come and go kind of interaction, right? They come over, they get something, I do something, go. Come back, I do something, go. It's gradual. I'm not gonna hold, it's all gonna happen in one, you know, in one sitting or in one time.
And let them take their own pressure off. We have a lot of dogs who will, if you make it a game where they like come and they do something and they get a treat and then you toss one and then they go and then they can decide if they want to come back. It takes that social pressure off of like, it's more, now I have to fight you. I do cats on the table because I feel like a lot of them like to be up high. Also, our table, as some of you know, it looks out the window and then it has a fish tank.
It's not a table.
But it's got
But
heating
it's
pad
got
and
a
blankets
heating
and-
pad and a blanket on it.
It's a surface.
So it's a surface,
Yeah.
and they don't have to. I'm happy to do a cat on the floor. They like to be up high.
Yeah.
They still have the fear of falling, but they like heights. Heights make them feel safe, so I usually start them on the table. They also have a box on the wall they can go hide in, or they can get on the floor.
Yeah.
It's really up to them, just letting them choose. Probably like 75% of them will sit on that heating pad because cats love heat, and just like look out the window.
Yeah.
Or look at the fish.
But yes, if you take a yoga mat, take yummy treats like Dr. Fanucci was saying, we have treats that we would not really recommend you feed at home, right? The squeezed cheese, like I don't know who actually eats that stuff outside of the vet clinic.
A kid tried to the other day.
We have a dog who loves that.
I don't know, I'm sure people still eat that, but I think I think their sales have exponentially increased because of vet clinics using it.
Yeah.
So we use a lot of stuff, and like who eats potted meat? But we have all of these things.
I mean, maybe Val probably would.
But if your vet doesn't have those things, then bring them with you.
Yeah.
Bring some chicken breast, bring some string cheese, something that they don't normally get. And that's part of advocating for them. The mat, the treats, all of that is good stuff because again, surprisingly, just some clinics also still they just don't really know what it is or how to do it or where to start, or it seems like too big of a movement. It's not really that serious. Let's not worry about it. And it's probably going to take 3 to 5 more years before it is really throughout most of our clinics, and with you guys starting to ask for it.
Yeah, the pressure coming from the industry isn't working.
Right.
No.
It's gonna have to come from you guys because it's just not working because we get blown off. Oh, you know, things that we've actually heard, oh, that's just frou-frou. What cortisol does to your body is not frou-frou. Even if you don't care about mental health, right? Which I even think that's ridiculous. But even if you don't care about that, oh, mental health, it's not. You're just one creature. You're just one, you have your brain and your body, it's all one thing. You cannot separate them. It doesn't work like that. And every time you turn around, there's some research about what stress does, what serotonin does, what PTSD does to you. And it's more every time you turn around, you find something new. And it's not good things. It's not like, oh boy, this stress is really good for you. Yeah. Oh, we have a question in the back. Hi.
So should we be more concerned about anxiety-inducing events in our senior dogs?
Yes.
Oh, yeah.
Because dementia also makes anxiety worse, just right out of the gate. their resilience is down, their brain is aging, they're gonna be more anxious just in general. They also might have more of the things that cause anxiety, like pain we don't know about, dental disease, arthritis, metabolic issues.
And trauma triggers the early onset of dementia as well. So if they are going to have it later in life, but they have traumatic events now, that can trigger the early onset of the disease. So we definitely want to worry about our senior patients. Yeah.
Ooh, should we talk about some stress relieving like things in the moment?
What I was just gonna say is, you know, because sometimes we don't just have high stress patients, we have just like this high energy and excitability in our patients too. And there was a question about that. You want to talk about that?
Yeah.
Which then, yes, would also be the games and stuff.
Yeah, I mean, we can cover both, I think, for this. If we'll start with just high energy. If your dog is high energy and excitable, like many of our dogs are, it's kind of twofold because they do need exercise, but they also need mental stimulation. Because if they just get exercise without mental stimulation, like being on a treadmill, throwing the ball can be this too, they're just going to build stamina, and eventually you'll wear them out. But instead, you're going to have a very fit dog who needs more and more and more and more every day. That's not to say don't exercise them, but if the exercise is something like a walk instead, where it's maybe a little bit slower pace, but they're sniffing and they're seeing things. Sniffing is both calming and stimulating because it's such a natural behavior. It's how they get so much of their information about the world. If your walk is that, or even like a jog outside if you're very fit, unlike some of us, something like that versus a treadmill is gonna get that mental and that physical side. Mental games, it snows here. A walk or a jog is not always gonna work out. It's dark at 3 o'clock, I got home at 5, I don't wanna go for a walk. Great, get them a puzzle toy. Get them 5 puzzle toys and rotate them out every single day. I don't have a puzzle toy, my dog's going crazy, just hide treats all over the house. Hide their food all over the house. Throw their food out in the yard and let them go scavenge for it. It doesn't even have to spend money, but that will get that part where you're like, I took him for a 2-hour run and he's still crazy. That's why, because it's not the mental part. Teaching them tricks, dogs love to learn tricks, so do cats. You can clicker train your cat, you can clicker train your goldfish, you can clicker train anything, chickens. And doing kind of the mental thing, and then when those needs have been met, teaching them, and this is where you're gonna go see Kayla for help, teaching them how to settle down. Like, I know you've had everything. You had mental stimulation, you had physical exercise, you've had food, you've had everything. Now you're just kind of sort of ADHD, right? I say that with love. Now you have to learn how to go settle down. Because sometimes, like a toddler, we get tired and we get more wound up, and we have to learn how to go lay down. If it's more like high energy, excitability, or stress at like the vet clinic, doing some little games with them can go a long way. This is another way you can advocate. Toss a treat and see if they'll come back. Because most dogs will eat a treat, but this is social pressure to eat a treat out of your hand. Because I want that treat so bad, I'm gonna do it, and then I'm stuck in this tractor beam and you're too close to me. I don't know how to create space because I never learned how to disengage. That's not something we usually teach, and now I have to bite to make that space. So even if I feed a dog a treat, then I throw one. Because then they have to go away, and then they can choose to come back if they want to keep interacting. Or then if they go away and they're like, oh, actually, thank God. Now I took the pressure off, I don't actually want to interact with you, that was too much, I just really like that food. Then I'm safe, and he is not over threshold because he got to go away. And then they also learn how to disengage, like, oh, actually I did that and that felt really good. Eventually, I'm gonna put that together to leave. If they're even too nervous for that, just scatter some treats and let them find them over there away from you. Just in the vet, just looking for treats, just eating tricks that they already know, tricks that they like, easy tricks. Sit, spin, nose touch, not high pressure treats. Most dogs do not want to give the vet a paw. You'll see them kind of go like this. They're like, that's my trick, but I don't actually want you to touch my foot. So a nose touch is very easy, and then you can toss a treat to disengage. Teaching them in advance to get in what we call a center up position, where it looks like you're riding a horse. Like you're standing with your feet apart, they're facing forward, and then their butt's behind you. That does a lot of things. It's comforting, they're with you. You can also then, you or another assistant can feed them from the front and distract them while the vet's doing something from behind. Not a lot of social pressure that way. Cats, the safe space like we talked about. That's the biggest thing. Just a safe space. That's what they want. Some will eat, some won't, but regardless, they all want somewhere kind of safe to be.
What if your dog won't leave you that clinic?
We overdid it with the fear free with Begwin.
It's not a good problem.
She has to drag her out of the clinic.
Yeah. If you guys want to learn how to do, what I teach my clients to do is like, since I don't have time to do the training during the exam, because it's a limited amount of time that I have, what I teach my clients to do is train them at home to come to the vet and tolerate procedures. So that's what we call cooperative care. That's we're moving from low stress handling, or still using low stress handling, but going to a cooperative care era where there is no stress and everything is voluntary. Cooperative care, to be able to be called that, we need permission. It needs to be voluntary, and we need permission from our patient to do something. But if they learn and they think that that's actually a trick that we're playing, or a game that we're playing, then they voluntarily tolerate that procedure and then just let you do it. And we do cooperative care for physical exams, temperature checks. We can teach them to tolerate the thermometer and not run away from it and not have a bad experience with it. There is a way to desensitize them to the thermometer. We teach them how to do exam of the head, which is very scary. We have to look at their eyes, shine a light in the eye, put something in the ear that pokes the ear, look at their nose, look at the mouth. So how can we teach them to allow us to examine the whole head area without that being a stressful visit, right, or interaction? How to do vaccines. So I have actually videos of those procedures where I teach my clients to do it. They practice that at home. For how long do I have to practice? 3 to 5 minutes once a day. We'll just do a little bit at a time until you build that. So you build, right? You're not going to teach everything in one day. It's not a crash course.
If you start before they're anxious, it'll take less time too. If you start it from 0, it will take way less time than if they're already, because most of this stuff, including the vaccines, isn't really painful. It's not the pain. I mean, sometimes if we're talking about the x-ray situation, absolutely, but the needle, they don't care about that. These dogs will jump off the deck and hit the ground running. They do not care about the needle 9 times out of 100. It's the social pressure and the weird lights and the smells and the vets being weird, and we hold our breath when we listen to the stethoscope, and that's a threatening posture.
It's the restraint.
It's the restraint
is the worst part. So if you go to my website, the Oklahoma State University Vet Teaching Hospital page, you're going to see a tab that says services, and then under services you're going to see behavior, which is my service. And in my page I have a link to videos. I have a ton of YouTube videos where I'm coaching, teaching my clients exactly how to prepare their dogs for the next vet visit.
I'll add that to the QR code if you send me that
would
link.
be great. I have the QR code on the website too. I can see.
Okay, perfect. I'll add it to that resource page.
Because if your dog comes to see me and already knows what to do, so one of the challenging things is exam of the head, like I said. So what we teach them the chin exercise. So we put the hand and say chin, they place their chin. And then we examine the eyes with the light. And then they go away, they get a treat. So release pressure. Chin, look 1 ear. Let go, they get a treat. Chin, and you see, I have videos of my clients doing it, it's hilarious. They don't have the tools, but they'll get a pen and then say chin. Stick the pen on the ear, like, stick something on the nose, and the dog does, instead of doing this, they do like, something like you twitch your nose because it's something poking their nose, right? But they think it's adorable to watch, and then start wagging their tail and they get the click and treat, click, treat, click, treat. So it's clicker training for vet procedures. I have a dog there, a husky, that took me 3 training sessions. Total training time was about 40 minutes, 10 to 15 minutes per training session. He was a dog that needed to be sedated for nail trims, fully sedated with injections. He's owned by a vet student, so I worked with her, and in 3 training sessions, we were trimming his nails voluntarily. We had the same problem, so we taught him to give the paw and hold it, and then we would go after practicing the steps that you're gonna watch in my video until we could trim a nail. Well, one of the last sessions, he came, he sat there, offered the paw without us even asking, and I was like, okay, I already trimmed the nail, and he gave me the paw again. But I already trimmed the nail, he gave me the paw again. And now they don't wanna leave. You walk around the room, they follow you, they sit and offer the paw. Like, okay, we already did that.
And if you do this before they have trauma, My dog who became diabetic, no trauma with needles, I taught him in two-minute sessions to take the shots. Now, every single day, walks over to the counter and puts his head on like this. Because he gets a treat after. He doesn't care about the needle, it's just big. But if I like wrestled him down and I'm okay, we're gonna do the needle, he'd be like, what is happening? And this is not like a good dog. This is a very neurotic, high-stress dog. It still took me 2 times of 2 minutes. This is not like an easy dog in general. Let's do this last question. We have a anonymously submitted question, although I do know who it is. A Cocker Spaniel that does not come into the house and hides under the bed and stops when they're on walks. If this particular individual is willing to not be anonymous, I do have some follow-up questions. Okay, great. Because the answer is kind of different. Does she think it's a game or is she stressed out?
I think she's stressed out.
Okay.
The one thing on the last walk that I had her on, the school bus came. She's afraid of little kids. There were no little kids that got off the bus, but she did not want to walk any farther. And it's like, I didn't want to walk back the long way around to get to the house when the short way was that way.
Yeah.
And then finally, she just decided that she was going to go again. And I have no idea why. Her going under the bed is something new. I don't know why she's doing that. There's nothing under there. There's no treats under there. You know, the cat likes to stay under that same bed. But she's big, fat enough now that she has to like scoot herself under there. Our bedroom's upstairs. We're watching TV. You can hear her scratching on the floor.
That's a safe space for her.
I think she's stuck, though. She can't get out.
I mean, to keep her from getting stuck, I would just try to transition her from going under the bed to like a crate or something. But that's just a Band-Aid. That doesn't solve this. But just to keep her from getting stuck under the bed, you could do that.
What we've done now, we put a baby gate across the door so she can't get in there because thankfully we have a bed that raises up, you know. And I was able to raise the bed up and lift her out, but she's like 30 pounds. She's heavy to lift up out. She's my special dog.
We've all got one of those.
Yeah, so that she's going there out of fear, right? She's trying to hide from something.
Yes, but I don't, that's the problem. I can't figure out what it is she's afraid of.
Right, so it could be some of the things that sometimes they react to, we don't perceive them. It's a sound, specific sound, or a specific odor, specific noise outside that happens at that time. So I have patients that do that. It's always 9:30 in the morning. This patient goes in the bathtub and won't come out for an hour. Well, now we figure it's the noise of the fridge door. And there's the time that the client, you know, the husband takes the medication, stays in the fridge, and when he does that noise, a specific noise, the dog, it's always 9:30 in the morning.
Yeah.
But when the wife opens the fridge, it's not a problem. It's always with the husband opening the fridge for some reason. So there's a noise, something in a dynamic. So it took us forever to figure out what it was exactly this patient was reacting to, because all the other times of the day it wasn't a problem. But at 9:30 in the morning, on the clock, and the client thought that there was some kind of seizure. I said, no, it's not a seizure. This is fear response, right? Once we figured what it was, then we started making positive associations with the fridge, the husband going to the fridge, opening the fridge door, you know, the whole medication. So then we started playing like pattern games. Pattern games are games that we can play that helps them, you know, with a lot of things, but like helps them cope, helps them not react to things. Do you guys do pattern games? From Leslie David?
I don't know if they call that specifically, but I know I think that's what you're talking about.
Yeah, so we do the pattern. I love the pattern games. So we started playing pattern games before, and then we had the husband play the pattern games and get closer to the fridge, closer to the fridge. But we knew what the stimulus was. You don't know what it is exactly that's caused. It's fear.
I wonder if she's trying to avoid going outside. Like, if outside is the fear and like the kids, if now she's just like, okay, well, I'm gonna hide there so they can't take me outside.
But sometimes she doesn't have a problem going outside. If she's gotta go potty, she's very well housebroken, she goes outside, then she won't come back in.
But how long does she stay hiding under the bed or under wherever she's hiding?
That probably was she was probably under there less than a half an hour, but
Then,
I removed her though, so I don't know how long she would have stayed there.
But I would actually figure out how long she would stay there and just not remove her. Because look, she's doing something inappropriate. Even though we don't like that she's fearful or something, but I would actually observe that. I would actually allow it to happen, and if you can video record it, even better. My clients video record a lot of things, and then I can see things that they're not seeing. or, you know, there's a specific sound that happens, it's a construction or something, right? So you actually see how long she's gonna stay in there, because she's hiding from a fearful stimulus. It's probably better to let her figure out there's nothing going on and come out on her own than to try to get her out of there, right?
I'll do that.
So that will give you time to actually figure out what's going on that's causing her to go in there, because she doesn't have a problem going outside other times of the day. There's something happening that's triggering the fear.
If she's getting stuck, can you put a little riser under so she doesn't get stuck?
We probably could, but it's.
Okay, that way, I don't know.
Yeah, or give her a carrier, a crate, or a big cardboard box with a, you know, a little cut door, so she needs a little cave she can go hide in.
Yeah, she's got a crate. We could leave that bedroom door open, let her go in
Right.
there. The other thing I'm trying to think, these dogs are pretty smart. And when she stays outside, I'm wondering if she's trying to get me to go out there because she wants me to play ball with her.
That could be.
You probably have a couple different things going on.
You know,
yeah.
Because dogs are that smart. At this time, I want to go outside and stay out there so you play ball, but at this time, it's a scary kid noises and I want to go hide under the bed.
Yeah.
Yeah.
Yeah, exactly. But then hiding under the bed is actually not that bad. It's better to hide under the bed than to do something that is not good for her or for others, right?
Yeah.
So resorting to getting reactive or self-mutilation or start doing other displacement behaviors.
Yeah, no, she's.
So it's better to just have, okay, the stimulus is gone. Oh, okay, it's been 10 minutes or 20. Nothing really inappropriate with that. And she'll come out on her own and be her own self again. It's better to hide than to react.
Okay.
Yeah.
Thank you.
Do you guys have any other questions? Yeah.
I have a question. So I have a dog that is, like, we have a chain link fence in the very back. On the sides we have privacy fences, but in the back we have a chain link. And then, when the gentleman that lives behind there, who's very nice and very dog friendly, comes out, he'll, you know, bark, you know, he does his thing, you know, he sees them behind the fence, he barks. So would you suggest, like, just not, like, reinforcing it with any kind of comment or any kind of, like, he thinks, because what I'll generally do is I'll say, okay, thanks for you, because I know he's doing his job, so I'll say thank you or something for his help, and I'll say, okay, you're fine, that's enough. And sometimes he listens and sometimes he doesn't, he doesn't want to do it. So I don't know whether I should just not give him any kind of attention, or if I should do something different to get him to listen to me telling him to, that's enough.
What you can do is do what we call barking allowance.
Okay.
So they learn a concept of time, but you have to teach them that, right?
Mm-hmm.
So something, because barking at the fence is normal.
Mm-hmm.
They're supposed to do that, right? But you don't want them barking for 2 hours.
Right.
Maybe that's too much.
Yeah.
So you're gonna give them a barking allowance. Whatever it is, the time that you can tolerate. I wanna say, can you tolerate 30 seconds of that barking and running around and all
Yeah.
that? So
Yeah.
then you will allow the 30 seconds to happen. You say nothing, right?
Yeah.
And then when 30 seconds are up, now you're gonna give a verbal command, but you're not yelling at your dog or calling
Right.
you by the name or saying, no, you stop, shut up. You're gonna say a word that's neutral, that's
Okay.
just a signal, right? I'm signaling you to you that that's enough. Maybe use shush it or enough, something like that, right? But don't yell at them or call their
Right.
name.
Yeah.
And then you're gonna bring them back inside,
Okay.
right? That's it. Now you practice that. Practice that. Over time, they learn. They go outside, they bark for 30 seconds, and go back inside. Because that's their default now.
Yeah.
It's just like training. That's just like, okay, that's what we do. I'll go outside, bark, 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 and then go back inside. And then they bark louder because they know they only have 30 seconds. All the barking out of my system, now I'm gonna run inside and get a treat. Because then we go inside and get a treat. We throw a party inside the house because we came actually back inside, right?
Okay.
It's working on the recall and training them and allowing them to bark because it's normal behavior. He needs to be a dog and bark.
Right.
But then he goes inside and something awesome happens. Not only I got to bark at the neighbor, but then I went inside and got a treat.
Okay.
This awesome treat, like roast beef, something amazing, right?
Yeah.
Yeah, so barking allowance.
Digging is the same way, by the way. If your dog likes to dig and won't stop, get him a sandbox, and teaching them to dig here is easier than don't dig at all, because digging is natural behavior. But you can teach them to dig over here. You can bury toys in there and stuff and bones, and it's super fun.
Yeah.
They have digging allowance too.
Yeah, I have clients that actually will fence in a little area of their backyard, because the dog was digging all over. Okay, now we have a digging spot, right? A digging site. So it's a little fence that they can jump actually, but they learn, just because there's a fence, they learn that that's their digging spot. And they go there, dig, 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 and then go back inside. Get a tree.
Okay, that's a really good idea.
This is what the parking lot.
Yeah.
I like that too.
Angela, did you want to talk a little bit about your adventure with my co-pilot for a minute?
I'd love to.
Come on up.
You don't have to run. You're doing great. I am not a public speaker. Ladies, thank you so much. This was an amazing event, and I learned a lot. I love that you give our animals their agency and appreciate their personalities and their individuality so much. Hi, I'm Angela. I am of Big White Dog Photography. I have been in operation in the beautiful inland Northwest for about 8 years, and I really wanted to kick it up a little bit this summer. And so what I'm offering is a fun little scavenger hunt called Adventures with My Co-Pilot. Does anybody remember Foursquare? Yeah, I was the mayor of so many places, and I was that nerd. So there's gonna be an app, and it's gonna be very much like Foursquare. And it is dedicated to the memory of my first co-pilot, Shep. He was, this always happens. He's been gone for about 11 years, but he changed my life in so many ways that everything I do with my camera and with my current dog, Bella, is a tribute to him. And this is me and Bella on our trail. And so there's gonna be a ton of fun prizes. I just named a title sponsor. It's a toy company called houe, and they're kind of new on the scene, and I'm doing everything I can to spread the good word about houe. They sent me a box full of toys the other day, and I was like, oh my God, I didn't think I was gonna get this much. And I have a gift card to Craft and Gather, a 10-session hydrotherapy package at Palouse Veterinary Clinic to give away. So it's going to be a lot of fun. You're going to download this app and then go to all these awesome locations around Spokane and Coeur d'Alene, check in on the app, take pictures of you and your dog and upload them for extra points. And yeah, and I'm just gonna give away a whole bunch of stuff. And then the person with the most points at the end of the summer wins a free portrait session with me and a deluxe photo album that is valued at $3,000. And second prize is a 24x16 print, which is the value of $1,000, and then third prize I can't remember because I'm all nervous and stuff. You're doing great. You're doing great. So it's really just about spending time with our dogs. I think it was you said something about we can't build relationships with our dogs if we're not with them.
At the dog park,
right?
Yeah.
And that's how I've built relationships with my dogs, is going out and doing things and having fun with them and building trust and bond on the trails up in the mountains and stuff like that. So there's something. Oh, okay. Officially, it starts on May 24th, which is the day I brought Shep home in 2004. And it all wraps up on August 29th, which is the day I brought Bella home on 2014. We have a few special events. Next weekend, if you sign up this weekend, you are going to be able to start collecting points before everybody else does, because next weekend at Hauser Lake, I am at the Double J Dog Ranch Icebreaker Run. And you can start collecting points just by showing up, by taking a selfie with me, and making a donation to Double J Dog Ranch, which is a nonprofit that I am very passionate about. And then on August 2nd, the Sniff Spot, hey,
Up in Valley Ford, Dawn to Dusk is opening the doors for an open house to launch National Dog Month, and just be there, hanging around, picking up extra points. And then on August 20th, we are going to a sniff spot in Otis Orchards for a candlelight vigil for the co-pilots who are no longer with us. Because, and I know it doesn't seem like it right now because I'm not doing a very good job of holding myself together, I am also a pet loss grief specialist. And I don't do a lot with that. I used to have a podcast where I interviewed people about those things, and I ended up, this is how I met these wonderful ladies. They were on my podcast to talk about fear-free veterinary clinics. But yeah, so.
Can I reframe that for you?
Yes, please.
I wouldn't trust a pet loss grief specialist who didn't care about their own pet loss. So keep that in mind.
Thanks. I appreciate you. So that's it. I have cards on the back table with a QR code, which makes it easy to sign up, but I also have my Chromebook open to the page where you can sign up if you want to come on back and have a chat.
And then we'll also put your information on our resource page as well for that.
Perfect. Thank you.
Awesome. Caleb, Brayden, you guys got anything to say?
Not all together at the same time, guys.
If you guys have any
come on, Brayden.
behavior training,
motivation,
fun adventures with your dog, day camp type things.
Come on up here.
Come on, Brayden.
Come on, Brayden. Yeah, Brayden.
So Brayden and Kayla used to work at the clinic with us, and then they, as of the first of the year, went to their business.
Yeah, so we did work at Letticia, and Kayla is a trainer and behaviorist. I myself am a trainer, and we run a daycare, but this daycare we take dogs out on adventures for about 2 hours during the day. And then, I'm not a public speaker either. We also do training Tuesdays and Thursdays starting in June. We have you drop them off, do a day train, and then when you pick up, we go over what they learned for about a half hour with you, train them what they learned so you can continue at home with that training. And then we are actually also starting a puppy program. So if you have a puppy, might not have like time, or if you have to go to work and you don't want to leave them at home, or if you just need a little bit of a puppy break, they can also come hang out and spend the day with us, and we will do early socialization to prepare them for the rest of their life. So
where are you guys located?
Actually,
right up the hill.
Yeah. So
you see the big red barn on the top of the hill?
Yeah.
In there.
Yeah.
Yeah.
Yep. We are renting the space from them. So if you just look up Letticia, we're basically right there, just in the giant red shop.
If you look up while you're in Letticia, you will see them on the hill.
Yes. So we usually have the sign on our table, kind of on the gate that is up at our facility. So, yeah. Anything I missed?
Yeah, you missed that. We film everything.
Yeah. Yeah. So in our
who's
day
that?
train.
Is that Kayla?
Yeah, that's
Oh.
Kayla.
Oh, hello.
She's there. But in the day trains, we do train our full training sessions. So when they're out and training with us, we film them and send you all of those videos as well. All right.
I have a golden retriever. He does go to day camp with him on Wednesdays. We call it fat camp. Yeah, she bear loves it. It is just a different, right, because sometimes dogs have to go to daycare. And some daycare places have areas where they can be by themselves. But I think the traditional idea of daycare is they're all out and they're together and they're having a great time, which is fine until they're not. So, right, they cap the number of pets that they allow each day, and they're they're helping enrich them and stimulate them and take them out on adventures. So when we're on there every day, when Dash is up there on Wednesdays, I can look on their Instagram and see the fun adventures that they're out having on leash or at a sniff spot, and what they do when they also get accosted by dogs not on leash. So go back and talk with them if you have questions about that. And then, like I said, then we have some team members of ours too, if you're interested in talking to them about our clinic. Hopefully, we want to try to do this every year for the community and try to get the other fear-free clinics involved. We didn't get much involvement this year, but hopefully every year we get a little bit more involvement. But that QR code will also take you, on that website is a fear-free directory, so you could look up. A lot of clinics, even though they're not fear-free certified, they do have fear-free certified individuals in there, or maybe one of the doctors is fear-free certified, because we find that a lot of clinics we are not fear-free certified and most of us don't do it, but Dr. Smith does. And so you can see that on the fear-free directory, and you can always request to see a special doctor at any clinic. Any clinic should allow you to do that, assuming the doctor's there that day that works with your schedule. So you can look on that directory by your zip code and just kind of see who the fear-free certified professionals are. We only have a few fear-free certified trainers in the area. In fact, it's Kayla, Braden, Dr. Megan, and then Megan Becker, who is Dr. Marty Becker's daughter. She is a local trainer here as well. And then so far only one fear-free certified groomer who couldn't be here today, but she owns What the Fluff Grooming. And so her cards are back there. But slowly we're trying to get more fear-free certified professionals and businesses in our area to really help our pets.
It has to come from them.
Yes.
Right.
Which is why we're here. Like we're gonna keep doing events like this so that we can just to speak to the community. We try to get on podcasts that the community listens to so that it doesn't seem so foreign. When we're in clinic, you won't really hear us talk about fear-free. You'll hear us say things like low stress. But we want everyone to get familiar with the term fear-free and start talking about it.
And there was one question about how to recognize body language. I just wanted to say that those resources are on the QR code too.
Yes.
There's lots of good body language resources on there if you want to start identifying what your pets are doing.
Yeah, nice. Also, there's still some box lunches back there if anyone wants to take a sandwich. But yeah, any last questions?
Yes.
You're Letticia, the behaviorist, right?
Yes.
Okay. I was wondering if I'm very interested in learning more about cat behavior. Do you have a certain school or certificate that you would recommend for that?
Yes, actually there is, you can get feline certified, there's feline certifications out there. I don't know how many there are for like pet owners. A lot of them are for veterinarians practicing feline medicine. Do you guys know anything about pet owners?
Well, for one thing, I would just get fear-free certified because there's you could do.
They actually have a fear-free pet sitter.
They should have a pet sitter
certification.
And then also check out. I'm not 100% sure if they have an owner one, but the AAFP might. The American Association of Feline Practitioners might, but fear-free definitely does.
Oh, one that you can get, the low stress handling. Okay, so if you go to Cattle Dog Publishing, you're gonna go into the low stress certification, low stress handling certification. They have a feline one specifically that you can take one module only.
What was that called again?
Cattle Dog Publishing. It's Dr. Sophia Ian.
Okay.
Yeah, it used to be sophiaian.com, www.drsophiaian.com. Now it's Cattle Dog Publishing.
Okay, thank you.
Yeah, and it's a low stress handling training. So they have different modules. They have one specifically for cats.
Awesome.
Yeah.
No, it's not that, because we could put that on the resource page as well.
Yeah.
We'll put Leticia's stuff too.
Yeah.
I was gonna ask you actually, are we able to email with any questions or anything that comes up?
Sure.
Yeah,
Okay.
yeah, you can email. The only thing I cannot do is like if you email me and ask about what medication should I do for my cat, I can't give medical advice over without having a relationship with you.
Yeah.
But if it's like general questions, yes, I can help with that.
Yeah, her direct cell phone number is 519.
At the end, come talk to us about the probiotics.
Oh, you got that.
Yeah,
Okay,
yeah,
I totally will.
yeah. Okay. Okay. All right. Thank you
Okay.
guys so much for coming.
Tips you have for incidents that stress our dogs that we can't necessarily separate them from? So for example, dogs are stressed by weather or fireworks or things like that where we can't necessarily
Yes.
The short answer is medications.
Yes, but you can do desensitization, right? So you can do progressive desensitization to certain stimuli that you cannot prevent happening, right? So yeah, medications when it comes to vet visits and everything vet related. Or let's say weather related like storms, right? You can definitely do medications for those things. All of those like tornadoes, hurricanes, events like that, thunderstorms, if you can predict it. But if you want to desensitize the animal to these things, because you live in Florida and it storms every day, you know, so how are you gonna sedate the pet every single day when it storms every single day during 3 months of the year, right? So for certain things you can do, and there are resources online that you can trust. I don't know which ones you guys referred to, but Victoria Stilwell is a good one.
Yeah.
So you can go to, what is her website? Positively.com. Yeah. So if you go to positively.com, that's Victoria Stilwell's page. She has a lot of desensitization protocols for storms specifically, or fireworks for sound. Fireworks, I don't think it's worth desensitizing because we only have 4th of July and New Year's Eve, right? So then you medicate them, you sedate them those days. They don't have to be part of any of that. But noises in the house, for example, the coffee maker makes a noise every day and then they panic, the vacuum cleaner. There's a lot of things you can desensitize them to if you take the time to do the training. If not, medication, definitely.
And also you could set them up a safe space, a kennel with music and the pheromones while it's happening, especially if a thunderstorm like creeps up on you like they do, because I can never time the medication right for the thunderstorms.
Yeah. But Victoria Stilwell has all the protocol for all that, like how to set up the environment, what's white sounds or, you know, like neutral sounds to use, how to make a bat cave for them, how to do the training while they're in the bat cave. So there's the whole protocol you're gonna find in the positively.com.
Or surprisingly, Jackson Galaxy. You know, it looks like one of those shows that you should blow off, right? For cat behavior, he's actually pretty good. I don't love all of his like drops and remedies. I think he kind of went down the rabbit hole with that. But the actual cat behavior stuff is really good. Watch My Cat from Hell, hate the name, love his tips. Like he is good with cat behavior.
I think he has a book too.
He does, yeah.